you all join us. I'm very grateful for the partnership that we had with UNFPA for this particular project and for the support and cooperation of the very many organizations that are doing some fantastic work and which we got a chance to witness in person and to also interact with their staff, children, and young people as well as women that they were supporting. So, without much delay, I will hand over to my colleague Ranu, who will steer us today, and we will get through the proceedings.
Thank you, Swagata. Good afternoon, everyone, and a warm welcome to today's webinar. Thank you for joining us for the release of the report, Empowerment and Rehabilitation of Children and Women in Childcare Institutions, Aftercare and Shelter Homes, Models and Replicable Practices by Enfold Proactive Health Trust, with support from UNFPA India. Before we begin, just a few housekeeping points. Please keep your microphones on mute during the session. If you have any questions, kindly type them into the chat box or raise your hands and wait for the moderator. We will take them up during the open house segment. We're delighted to have you all with us today, and we look forward to an engaging and thoughtful discussion. To formally open today's session, I'm pleased to invite Dr. Deepa Prasad from UNFPA India to deliver the opening remarks. Dr. Prasad currently serves as the Chief of Programs and Technical Support Unit at the UNFPA India Country Office. Prior to this, she led the UNFPA Odisha office as state head and has also worked with the UNDP. With over 15 years of experience at UNFPA India, Dr. Prasad brings deep expertise in policy design, program management, coordination, and leadership. She holds a master's in public health from the London School of Hygiene and Tropical Medicine, a postgraduate diploma in obstetrics and gynecology, and an MBBS from Bangalore Medical College and Research Institute. We welcome you, Dr. Prasad, and over to you.
Thank you, Ranu. Good afternoon, colleagues, partners, and distinguished guests. I'm delighted to welcome all of you to today's event, the release of our joint study report with Enfold Proactive Health Trust, which will be followed by panel discussions. Coming right after the International Day of the Girl Child, this launch is an important moment in our shared effort to strengthen care systems and support the empowerment and rehabilitation of women and children who have faced difficult circumstances. To give you a bit of a background and what led to the study, it actually emerged from a reflective conversation that UNFPA had with the then Additional Secretary of the Ministry of Women and Child Development. During our discussions, a few practical and pressing questions surfaced. How can care institutions create strong pathways for empowerment of women and children in institutional care? And what does the evidence tell us about what truly works? We know a lot has been written, a lot about the challenges in these institutions, from infrastructure gaps to shortages of trained staff. But there was very little consolidated knowledge about what really enables transformation and empowerment of women and children living in these settings. We also realized that while many institutions across India were doing remarkable work, their experiences often remained undocumented, localized, and unshared. It was this insight, the need to move beyond just gaps and deficits, and instead highlight, document, and celebrate promising replicable models that inspired this collaborative effort between UNFPA and Enfold. The report we are releasing today is based on a study documenting sustained and promising practices across 5 states: Delhi, Karnataka, Maharashtra, Telangana, and West Bengal, covering 18 facilities, including childcare institutions, aftercare facilities, and shelter homes. The study tells stories of hope, resilience, and innovation. It showcases how institutions guided by committed leadership and values of dignity, agency, and equality have been able to create safe and nurturing spaces for women survivors of violence, young care leavers, and children in need of protection. Through its detailed analysis, the report highlights what really makes rehabilitation effective. from physical and mental health care to education and skills development, from building agency and decision making to providing legal and social support, and finally, helping individuals integrate into their communities. Together, these elements form what the study beautifully calls the tree of rehabilitation. It's a framework that can guide policymakers and practitioners in creating holistic and person centered care models. For UNFPA, the study is deeply aligned with our mission, a mission of advancing gender equality, ending gender based violence, and ensuring that every woman and young person can live with dignity and realize their full potential. The findings are also directly relevant to the government's programs that aim to provide comprehensive protection and rehabilitative support for women and children. We hope that the insights and models presented in this report will inform ongoing efforts under these schemes, guide the development of state action plans, and support a shift towards survivor centered, trauma informed, and empowerment oriented approaches in institutional care. We are immensely grateful to Ms. Rashmi Singh, Secretary, Department of Women and Child Development, Government of Delhi, for joining us today and for her steadfast leadership in strengthening institutional mechanisms for care and rehabilitation. A special appreciation to our partner, Enfold Proactive Health Trust, whose expertise, rigor, and empathy shine through every page of this report. I especially want to thank the Gender and Human Rights team at UNFPA, led by Shobana, for coordinating with Enfold and guiding the study, from shaping our discussions into research framework to capturing studies and making the findings practical for those on the ground. As we move forward, today's panel discussions will help us collectively reflect on some of the promising practices across identified facilities and how we can scale up and replicate these models, address systemic gaps, and strengthen aftercare and rehabilitation services in India. We look forward to hearing from the distinguished panelists representing critical institutions whose lived experiences and tested practices will guide us in the next steps. In closing, I wish to reaffirm UNFPA's commitment to supporting the Government of India and civil society partners in advancing rights, dignity, and empowerment of women and children, especially those in the most vulnerable situations in every home, every community, and every institution. Thank you. Thank you very much.
Thank you, Dr. Prasad. I'll now invite Dr. Ms. Rashmi Singh, IAS, to deliver her remarks. Dr. Singh is currently serving as Secretary, Department of Women and Child Development and Secretary, Department of Art, Culture and Languages in the Government of NCT of Delhi. She is also holding the charge of Chairperson, Delhi Commission for Women and Chairperson, Delhi Commission for Protection of Child Rights. We welcome you, ma'am. Over to you.
Thank you. Thank you. Yeah. So first of all, I would like to compliment the choice of the topic on which this research was decided to be done. Because this is something which I must say has been a matter of concern for many of us who have been in this sector working within within the government, using various schemes and resources of the government schemes and programs. First it was the ICPS, the Integrated Child Protection Service Mechanism, and now the Mission Vatsalya. And why a matter of concern is because the care that we believe in, that today is getting more and more, challenged by the fact that it has to be seen as a continuum of care and not just children who enter our institution at a particular length of time, become 18 years old, or even in between, the Child Welfare Committee feels that the child can now be restored back. But what happens to that care? So this is, what happens to those children is something which has perplexed me, or women for that matter, who are not women centered. So both women shelters, children shelters, the CCIs. So this has been a concern that, yeah, are we able to do full justice to not just the rehabilitation, but the entire empowerment approach that we are talking about? Are they empowered enough to lead a life of dignity, self independence, and economically independent? So there have been, challenges in terms of implementation of the GJ Act, in terms of especially the non-institutional care. But the institution care and the non-institutional care, again, for me, the experience shows that, yeah, both have to be taken along together. And I'm really glad that with the support of UNFPA India, Enfold Proactive Health Trust has managed to come up with some very pragmatic models, some good practices across various states, including Delhi, in which Sanskar Ashram, one of our own CCIs, was selected. And I must confess that I have not read the report, but the report is going to be extremely valuable because there are many, questions before us. When we look at the kind of continuum of care, which starts from a home, say for that matter, Sanskar Ashram, I'd be really interested in seeing what findings your research, which Bharti Ali, has conducted along with the other researchers, interns. So, what findings are there and what takeaways are there. And I must also share that, during the International the Girl Child Day, which was celebrated globally, over the last weekend, Saturday, Sunday, at the Supreme Court, at the behest of Supreme Court, all the states, all the stakeholders, including the juvenile justice committees, the JJBs, the child welfare committees, the secretaries of respective departments of WCD, education, even the state commissions for protection of children. So, everybody came together. And 1.5 days of deliberation, not just talking about, how far we have gone, but also talking about the current challenges and what all needs to be still addressed. And then I must say that in terms of how far we have gone, we all acknowledge the fact that under Mission Vatsalya, we do have like definite institutional mechanisms, starting from, say, the State Child Protection Society to State Adoption Resource Agency to various childcare institutions being funded under the government support, and the district child protection units, the child welfare committees, the JJBs, the children helpline. But how much of a synergy there is, in all these mechanisms, including the synergy of the department of, say, WCD to work with health and education and the state commission or labor or police, because they are all equally important stakeholders. So, when we talk about like today's deliberation, I will not have the benefit of sitting through, but I will definitely want to see the takeaways which emerge from today and the report. And there are officers from my department of WCD who would be, clued in for the entire length of the program. And I really do hope that, it informs some of the things which we hope to carry forward in Delhi and also develop better models which can inform good practices for others as well. And we have an opportunity for the fact that, right now there was no guidelines that we were following. There were no standardized guidelines which had been adopted for aftercare, especially. So, a draft has been created with the support of, again, various stakeholders. And very soon, we hope that the kind of enabling mechanisms which are needed for the aftercare, especially, so including the financial support, maybe just to as a startup for any venture, or providing support to a family, so all that is, part of this particular aftercare guideline. So we hope to have the benefit of sharing it soon with all of you. And with this remark, I would like to once again compliment, everybody involved in the study, in the research, and nothing better than taking the research forward by involving the practitioners who are involved in this journey. Thanks for giving me this opportunity to be here. Thank you.
Thank you so much, ma'am, for your valuable insights. With this, we now move into this next segment of our program, a presentation on the key findings related to aftercare homes and shelters for women. I'd like to invite Shivangi Puri to present these highlights. Shivangi is a project manager at Enfold. She is a researcher and social worker whose work focuses on child protection, restorative practices, and juvenile justice. As part of Enfold's research team, she has contributed to studies on the implementation of child-related laws. She has also contributed to system strengthening of child protection system through capacity building initiatives for the child protection workforce across multiple states. Over to you, Shivangi.
Thank you, Ranu. Thank you, everyone, for being here and welcome to the conversation today. I'd like to start off by thanking the Department of Women and Child Development in Delhi, as well as the Directorate of Child Rights and Trafficking in West Bengal and the DWCD Maharashtra, as well as the Directorate of Child Protection in Karnataka for their support, as well as NALSA Telangana. These stakeholders have helped us gain access and also given us support in this study. I'd also like to acknowledge the voices of the young people as well as the women and the children that have been a part of this study. And would like to, and I hope we have done a good job of capturing their voices, as well as the voices of the staff of these institutions. I'd encourage everyone to read the entire report because it has a lot of information and a lot of findings. And I'd like to start off by saying that I'll just be presenting a snapshot of these findings today. I'll be sharing about the institutional rehabilitation models for women in shelter homes as well as aftercare. And my colleague Gopika later on after the panel discussion will be taking you through the findings on children and childcare institutions. Just to take everyone through the scope of the study and the methodology, we looked at 5 states, which included Maharashtra, Karnataka, Telangana, West Bengal, as well as Delhi. We looked at 5 states. And we covered 3 shelter homes, 3 aftercare facilities, and 12 childcare institutions. Within the childcare institutions, we focused on 14 to 18-year-old children. We did focus group discussions with staff as well as residents. And we also wanted to get a candid view of their experience. So we spoke to former residents who had stayed in these institutions. We also did interviews as well as got written responses from management. In terms of the institutions for women that were covered within this study, there were 3 shelter homes, which included the Nilojoy Shakti Sadan in West Bengal, the development shelter by Urja Trust in Mumbai, as well as the Pehchan home by Shakti Shalini in Delhi. The 3 aftercare facilities, aftercare institutional facilities we looked at was Udayan, Dhar, Guild of Service, and WeLive in Bangalore. In terms of the general profile of these shelters and aftercare, in shelter homes, there were adult women above the age of 18 who, as well as LBT plus survivors of gender-based violence or women in distress. They stayed up to between 10 days to 3 years, depending on needs. So depending on the type of crisis, that was the duration of stay. And children were allowed up to the age of 10 to 12 years of age, depending on the gender of the child. So if the child was a boy, after 12 years, the child would be transferred to a childcare institution. And this was varying practices were followed in different shelter homes. In terms of aftercare facilities, we saw there were care leavers between the age of 18 to 23 years old who were either pursuing education or employment. This varied in terms of different institutions. In some institutions, the condition of stay was that the care leaver or the young person has to be working, while in other institutions, there was flexibility in terms of education, that the young person could pursue education or employment. We know that there is some conversation around the term care leaver and its usage, and there has been current discourse on the usage of the term care leavers, given that young people are not leaving care entirely and do need support. But this is the term that is widely used at the moment, and that is why we're using it right now. Usually in aftercare facilities, young people stay from 1 to 3 years or until they achieve independent living or have a stable job based on their particular circumstances. And in aftercare facilities, there was no provision for children, like children of young people to stay, if any. I'd like to share 2 quotes from 2 staff members, one from WeLive, which is a after of young persons as being extremely strong and young capable people, and they view themselves as bridges or facilitators of being able to help young people realize their own potential and reach independent living. So that was a strong view that came through from WeLive, as well as the view that came from Shakti, Shalini, where they stated the distinction between rehabilitation and reintegration being there, and that rehabilitation does not necessarily mean that the survivor would want to go back to their family. And even if they did want to, that it would be on their own free will and their own terms and conditions. So the conflation of restoration with rehabilitation is often seen as that, that a young person or even a child has been restored. That means that rehabilitation has occurred, but rehabilitation is more nuanced and has more layers to it. So we asked all the residents of all institutions, including aftercare, children's homes, as well as shelter homes. We gave them a piece of paper and drew a hot air balloon, and we asked them to write on the top of the hot air balloon, like what makes you fly, and at the bottom, what pulls you down. So to capture their voices, we've put this together. So when they shared what makes them soar, they shared how it involved a sense of forming their identity and self-expression and their own personal growth, balancing that along with safety as well as relational care in terms of feeling supported, having emotional support, having relationships, and belonging was something that they really wanted. When asked about what pulled them down, there were several challenges they stated. Broadly, they spoke about challenges at school, difficulty studying, as well as the fear of living alone after leaving institutional care. And they also stated challenges with respect to infrastructure, as well as unfair rules, etc. We mapped out the approaches to change that different institutions had with respect to challenging gender-based violence and discriminatory practices. And we mapped their approaches into 3 broad buckets. So the first was structural change, which included challenging the root causes of the gender-based violence, which meant challenging patriarchal norms and structures that sustain gender-based violence and discrimination. We saw that that shelter homes like Urja as well as Shakti, Shalini challenged patriarchal norms by instilling critical thinking and reflection around issues of caste and patriarchy within their staff as well as their residents to be able to challenge the structural causes of this violence. In terms of functional change, which included empowering individuals to transform their own current reality and achieve independent living or achieve growth. This was something that all shelter homes as well as aftercare facilities really focused on. This seemed to be the primary goal of all institutions to ensure healing happens, to ensure there is support for them to grow, there is life skills, there's livelihood training, as well as independent living skills. In terms of systems change, which includes strengthening ecosystems or engaging communities and system for prevention and support, this included engaging mentors to support young people or to support young people as from within the community, as well as community involvement in the rehabilitation of women and young people, as well as having family strengthening programs outside of these institutions. So, as ma'am earlier mentioned about the tree of rehabilitation, I'll just share about the framework we came up with based on the interviews and our visits to adult spaces, so both the shelter homes and aftercare. We looked at we conceptualized the fundamental elements as being physical well-being and healthcare, as well as trauma-informed mental health care. So health being broadly viewed as physical health and mental health. Within physical health, we also saw sexual and reproductive rights and reproductive health as important components for service provision to women and young people. In terms of mental health care, this included not only having a counselor to provide individual counseling and group counseling, but also ensuring that the entire staff within that institution understands mental health and understands the implications of trauma, behaviors that might come up, responses to difficult behavior. And we saw that institutions were ensuring that all their staff were understanding the implications of difficult situations and mental health, and having a safe, secure, and inclusive nurturing space. In terms of core enablers, we saw that that identity documents were often lost, never made, or difficult to acquire. So women who may have left their homes in distress may have not taken the documents with them. Police support may be needed to acquire these documents, and these documents are essential so that they can gain access to government services. And this was seen as a core enabler in their rehabilitation. Balancing safety with autonomy was very essential to all women. In their experience of abuse or in their experience of violence, that autonomy was taken away from them in some way, the ability to make decisions or exercise individual choice was taken away. And in institutions where safety may be prioritized for the moment, they felt that autonomy was also important for them to be able to gain control of their own lives and decision making with regard to their own lives and things that they did. So that was really important to them, and they wanted that to be balanced alongside safety. In terms of another core enabler was education, skilling, and employment. And we saw that mental health care mental health status or concerns impacted their ability to, gain skilling, knowledge skills, or employment, be gainfully employed or meaningfully employed for a long period of time, or even learn. So mental health care also was really fundamental in terms of ensuring that education and skilling and employment does happen. The enabling supports of the rehabilitation for adult women included extended and continuous support. So as Rashmi ma'am earlier stated about the continuum of care that is required. So even after institutional care is over, there is non-institutional support that can be provided in terms of safety planning, in terms of follow-up, other kinds of non-institutional support like a drop-in counseling space. So these were essential. Non-institutional services were also essential to rehabilitation for women. A consistent daily routine with space for recreation and leisure, as well as ensuring that there was agency and participation in decision making for women, and ensuring that legal support was provided whenever that was something that the young person or the woman required. In terms of coming to very specific replicable practices that can be instituted in shelter homes, we saw that a child protection unit is something that is essential to ensure that the children of women who have experienced violence are also their best interests are also safeguarded and understood. So ensuring that forced separation does not take place because the woman has already undergone a lot of trauma, and the child may have either been an experiencer of violence or have been a witness of that violence that may have occurred between their parents. So there is a growing need to have a separate child protection unit within the shelter home to ensure the best interests and assess the best interests of this child and ensure that they are met. And we saw this, we saw that there's a child protection unit within Shakti Shalini in Delhi. Community involvement was seen as essential. So in Shakti Shalini, they opened up their skill development center to the community. So finding innovative pathways to ensure that the community is involved and feels benefited from these shelter homes. And this can be a good way to destigmatize institutional care and those who access and live in institutional care. Safety planning that was done by shelter homes, including Urja as well as Shakti Shalini, which included like having an understanding of who will these people contact in case there is harm or violence after they have left this home. What are the steps involved in planning for ensuring safety for this person? This was something that was seen as this is something that must be done for every woman who has faced gender-based violence. Having feedback mechanisms where, and this goes to facilitating agency and participation in decision making for women. Being able to have suggestion boxes, and we saw in Urja they had figured out a way to have accessible reporting options without having to read or write. So it was like a color coded system where people could respond to certain questions and give feedback in that way. Celebrations that and celebrations forming an important part, like festivals and celebrations in shelter homes as well as aftercare facilities, and celebrations to challenge stereotypes. And these celebrations included, like, for example, in Nilojoy, they celebrated, instead of doing like in Bhai Phota, where there is the brother is protecting the sister, instead of that, like challenging that and making it a celebration of sisterhood. And in Urja, like they would celebrate different equality and rights related days, including like International Girls' Day, Human Rights Days, etc., or Ambedkar Jayanti. So not necessarily limiting it to religion, but also challenging those stereotypes, using celebrations because that also did enhance belonging for those living in institutional care. In terms of mental health, using different modalities, including art, dance, theater, nature, somatic therapies, and we saw that across shelter homes. We saw that in Urja especially. Prioritizing emotional and physical health of staff, and that is something that ensures that the physical and mental health of the residents is also ensured and must be looked into. There was also wedding support provided when it was sought, in terms of vetting or supporting the woman who wanted to get remarried or uh, conduct their own marriage. So that was also provided, especially in Nilojoy. And maternal home support through mediation in case of conflict, or letting, like, in terms of the shelter home became a maternal home for like women to return back to in case there was marital conflict, and then they could go back, or mediation between between the partners. In terms of replicable practices in aftercare, we saw that work readiness was something that was essential and was focused on a lot, because it was transitioned from institutional care to then independent living after the age of 23, 25, depending on the needs of the young person. This included career exposure, internships, mentors, industry visits for skill building, and having skill building in terms that was tailored to the particular needs, capabilities of that young person. And we saw this in Udayan Care as well as WeLive and Guild of Service. This is something that was done proactively. Transitional support in terms of housing, finances, and transport and household needs. So when the young person was leaving the aftercare facility and was going to live out on their own, this was something that was in that transition period, there was enhanced support, including finding a house, finding a landlord, dealing with paying a deposit. Those kinds of things was also provided. A strong care leavers network that has been formed by Udayan Care as well as now WeLive, joining this care leavers network. So having different care leaver networks and having a strong care leaver network that can help with peer support, either job information, and care leavers also living together. In Nilojoy, we saw that former residents, and even in Udayan Care, that former residents would be employed within the institution after they had left Aftercare. So this was in some situations. So for like tutoring of young children or taking care of other young persons, and that would mean that they would stay connected to the institution or the organization as well. Having alumni.
Shivangi, sorry to interrupt. Can you wrap in like 5 minutes? Is that
Okay.
possible?
Yeah. I'm sorry, I didn't keep time. Yeah, and having health insurance coverage for institute for residents. I'll just take everyone through the challenges that we saw. In terms of transition related challenges in aftercare, so difficulty in transitioning from CCS to aftercare and after aftercare to independent living, weak life skills, as well as not having the vocational training courses may not be certified or having weak linkages in terms of provision of vocational training services or finding jobs. All of these have different solutions and need to be looked into. There was also challenges with regard to safety threats to survivors and staff, not having identity documents which blocked access to services, not having gender inclusive spaces, and sometimes it was seen that there was forced separation. Um, Measures need to be taken to ensure that these challenges are addressed in terms of providing, having, documentation drives, having more spaces that are inclusive of different gender identities, and providing childcare and rehabilitation programs for mothers, as well as having a child protection unit as Shakti Shalini does. Mental health and well-being is also an area of concern, and staff burnout is also something that does happen. So ensuring like a holistic approach to mental health was also seen as important. While it's already being done, but more can definitely be done in this regard. There are funding challenges in terms of limited flexibility, delay in gaining access to funds, as well as having a very low amount per person for vocational training in government schemes. So this would definitely require policy level reform. I'd like to leave everyone with some questions, and I'm sure there'll be many more in the many more in the panel discussion. Yeah, so I think the first question revolves around what does it mean to care and protect women while also creating space for independence? And a repeated question that came up was access to phones as well as mobility in and outside of shelters. What is the balance that must be maintained between livelihood training and addressing mental health needs of survivors of gender-based violence? And what does it like? How does this mental health and capacity of every staff shape service provision? We often look at mental health of residents as very important, and we need to keep recognizing that ultimately the implementation of the service provision is going to be done by the staff, and their mental health must be also prioritized. And what are the measures that we need in order to destigmatize those in institutional care? And with that, I'll stop. Thank you so much.
Thank you so much, Shivangi, for the excellent and informative presentation. With this, we now transition to our first panel discussion on future directions for aftercare homes and shelters for women. The panel discussion will be followed by an open house session and will be moderated by Suneeta Dhar. I'll take a moment to briefly introduce our moderator and each of the panelists. So our moderator for panel 1 is Suneeta Dhar. She is a feminist researcher, trainer, and a policy advocate for women's safety, rights, and transformative financing. She has over 40 years of development experience, designing and implementing multi-stakeholder programs on ending gender-based violence, building women's leadership, and engendering rural women's livelihoods. As co-founder and board member of the South Asia Women's Foundation India, she advocates for resource justice for diverse women's groups. Joining Suneeta, we have 6 panelists with us. Our first panelist is Anjali Thakur. Anjali is a feminist development professional with over 11 years of experience and a postgraduate degree in gender studies. She is co-leading as an operations lead at Shakti Shalini, an NGO working for gender equality. Next, we have Ashoka Dasgupta. Ashoka has been working with Women's Interlink Foundation for the last 17 years as member Women's Empowerment. She has implemented, coordinated, and supervised teams to carry out skill development programs at WIF shelter homes and WIF rural outreach centers. Our third panelist is Deepali D. Vandana. Deepali brings over 2 decades of experience in the development sector, shaped by her journey as a woman from a marginalized community who has faced gender and caste-based discrimination. As co-founder and managing trustee of Urja Trust since 2014, she leads a team of 40 women and non-binary individuals, driving initiatives on social change and community development. Next, we have with us Leena Prasad, Director, Advocacy, Research, Training at Udayan Care, Delhi. Leena has over a decade of experience litigating in various courts of Delhi before transitioning to the social development and human rights sector. At Udayan Care, she leads initiatives focused on aftercare, care leavers, and family-based alternative care. Our next panelist is Ramya Sundararajan. Ramya is the Chief Executive Officer at WeLive Foundation. She is a certified English language trainer and holds a postgraduate degree in management. Lastly, we have with us T. Sri Lekha, Honorable Secretary, Guild of Service Seva Samajam Balika Nilayam, Hyderabad. T. Sri Lekha is a graduate from Osmania University, Hyderabad. She has been associated with the Guild of Service Seva Samajam Balika Nilayam since 1988. We welcome all the panelists, and I now hand over to Suneeta.
Thank you very much for the invitation and also for the opportunity to know that such an amazing report has been done by Enfold and UNFPA. I have not read such a rich, substantive, and such a with a critical lens, but yet a very compassionate and caring lens. And I would like to congratulate all the participating organizations because, you know, as a feminist researcher, I'd recently put together a paper on Beijing Plus 30. And the few research reports that are available, including from my organization, Jagori, and from some of the networks that we were part of, the LCN network, we have old data, but I must say this is an amazing analysis. Thank you, Swagata and Fold, and Bharti particularly. I love the rights-based framework and, you know, the plethora of understanding the individual and yet looking at the system, because that's what we're looking at. We're really looking at an interlinked system and continuum of care support. And I know, having been engaged in this field for a long time and recently learning a lot through Shakti Shalini's evaluation of their Pechan Center home 2 years ago, that I really understand that this work is so intensive, it does not get the policy attention, the resources attention, and the political attention that it requires, because each individual is special and the group is special. And for each individual to put together an architecture of support that you talk about, from mental health to freedom to citizenship to being an active individual, being self-reliant, and then creating a network, I must say, is a huge task. So without further ado, I know we have limited time, so I'm going to keep my remarks to the minimum. And I invite you, wonderful people, because the topic really is to look at the future, much of what you're facing. I loved just to go back a bit, I loved the survivors and residents talked about, and you said what makes you soar and what brings you down. I loved the notion of freedom and fun. I loved the notion of friendship and family-like structures, despite the fact that the family is an unsafe place for many of these residents, yet they want a family-like structure. So how important it is for us to belong to alternative families and family-like spaces. Talking about communications and empowerment, talking about financial independence and an ecosystem of support. They're also urging us to look at the ecosystem of support. So within that, I open up to the first question. I hope you have seen the questions on the email that I sent to you, and I have sent you the order, so I will call you. But please feel free. You have 3 minutes in the first round. Please self-time yourself. I don't think I'm in a position to want to stop anybody, but do follow your own process of contributing and making this a very interactive and substantive. So if we take 30 minutes, then we can open up for 15-20 minutes with Q&A. Is that work okay for all of you? Yeah? Okay. So let's go ahead. The question really in the first round for me was, how do you visualize an intersectional ecosystem of aftercare support for young people and women survivors? Because you'll have different age ranges in the homes and aftercare services that you provide. And what do you think could be 3 enabling policy conditions that could inform taking forward the recommendations that have come in this report, the lessons that you have learned, as Rashmi ma'am says, best practices that you have documented, so that we could have better models of governance for the institutions, but also good practices for scaling up with different stakeholders and partners. So for 3 minutes each, let's start with you, Anjali. We will then go to Ramya, then to Ashoka, Leena, Deepali, Srilekha. I want to minimize the bureaucracy of the process. So Anjali, you hand over to Ramya. Ramya, you hand over to Ashoka. I think that will be a nice kind of a seamless kind of a conversation. If there's need for me to come in between, I will, but I will be with you in this process. Thank you very much for your time and for your substantive knowledge and contribution. To you, Anjali.
Thank you so much, Suneeta. I think I just want to take a moment and congratulate everyone who was a part of the research. And I think it's such a comprehensive one where even though Shakti Shalini was a part of it, there is only this much that we could give, and there is so much that we can learn and introduce all these practices in our work, because I think for us to grow further, for us to look at this journey as upwards and onwards, it's important for us to co-learn and co-create together. Going back to the question that you mentioned, I think this is it's a good platform for us to also talk about how we look at aftercare, because aftercare is often seen as only a short phase, and between a person leaving from the shelter home and becoming independent. So basically what we are talking about is economic independence. However, when we look at a survivor's journey, it is shaped by many things like their caste, their class, their gender identities, disability, religion, where they come from. So aftercare cannot be looked at from the same perspective for everyone, and it needs to be recognized in differences and support, that every person is unique and the support that we are providing will also be unique. The changes, if we talk about, can be how we shift the focus from short term support to a need based support, because I think healing does not end within a few months of time and a few trainings or housing facilities. It takes time, and it's an ongoing work. And it's important for organizations who are doing this care work to walk the path with the survivors over years and not just months. So what we follow in Shakti Shalini is that there is, after a rehabilitation, reintegration of every survivor, we continue the follow-up process for a year and a half, which kind of supports the survivor also to know that there is always a way, or there is always a, a a space for them to go back and get in touch if they are coming across any sort of challenges. Then the other thing is that the entire protectionist approach that institutions usually take because of the power that we all hold needs to be shifted to a community based sort of network, which will give survivors more space to share, and they will have enough recognition, and they will feel more empowered when their voices are heard, and when we are building programs and designing systems that has their voice. In 30 seconds, I'll quickly cover the the policy level conditions or things that we can really look forward to, I think one is definitely to look at it from a very intersectional and right based vision and a lens. And as organizations, if we say, it is important that no work is actually possible without proper funding. And because other if we do not have funds, intersectionality and looking at these things are just mere concepts, and we will not be able to execute those things. And these fundings need to be long term and flexible, because sometimes that also kind of puts us into a really tight spot. Then I think policies also must ensure that survivors are actively involved, how I was saying earlier, in planning, in monitoring, and in improving aftercare services. So their feedback is also equally important for us to look into the systems that we have built. And I think if we can build like a framework where national and state level aftercare policies are there, so that we also receive support from the government, because as NGOs we have only this much of power or finances. But if we can all come together, it will expand the work further. And then I think we need to move beyond women. I think it needs to include more queer and trans survivors as well, those who are seeking support. So that is from my side. I will quickly tap Ramya here.
Wonderful. Excellent. Thank you. Thank you, Anjali. Thank you so much for that. First of all, it's an honor to be part of such a distinguished panel, and thank you for this opportunity for us. WeLive works with care leavers, and our experience is in enabling them for independent, autonomous adulthood. So the points that I would be sharing is against that background. Our experience is more with enabling care leavers for independent adulthood, and we work with them. Our first engagement with them would probably be at 16 or 17 or 18, when they are ready to step out of care. So, and against this, I had 3 points on, what could the ecosystem do to enable, since a lot of our work is on the well-being and work readiness, and the program is built on the principle that, they need to be financially independent, and of course, their well-being and their, healing and their mental state has to support that, so that they are ready for autonomous living. So under this financial independence, we feel that the challenge that we constantly face is getting amenable employers for a care leaver to be ready for work and to be ready to support themselves because of the trauma that they have been through. It takes more time than other youth of their age. So the constant struggle for us is to find these amenable and understanding employers who would be willing to work with them, walk the miles with them, and make sure that they're holding their hand a little bit longer than is needed to make them capable of financial independence. So that I would say some kind of so we do a lot of orientation and sensitization with employers who join hands with us. We lay the ground for them. We prepare there. We have something called zero expectations, right? So come with a zero expectation policy kind of a thing. So that I feel is something that the ecosystem should be willing to support the care leavers with. Second is something that we have noticed, especially with because we are talking about women caregivers here, is the orientation that caregivers in the institutions have towards their relationships, their engagement with the opposite sex, or the physical and the emotional growth that they undergo, which we feel is extremely important, because the youth are very confused with the messages that they are receiving from the outside, from their own selves, and the messages that the caregivers are telling them. So they end up in this space where it is extremely difficult for them to navigate on their own. So if the caregivers' orientations on relationship management, on treating the youth as adults, if that is kind of empowered or enabled, we feel that would make a big difference. The last, with respect to the ecosystem, would be the the sustained follow-up. Anjali also spoke about it, sustained follow-up. But here I would restrict it more to the completion of the education. Right? We do see that caregivers are completely capable of finishing their 10th and 12th and graduation. It is just that because of their fractured background and their moves, etc., all of the trauma that they've been through, that they've had a gap in this. But it is so essential for their own selves, for their own self-esteem or self-respect, as well as the world to validate their space, that there should be a sustained follow-up with the caregivers for completion of their basic 10th, 12th, and graduation. So with this, I think, the ecosystem could support them a lot more. Coming to the enabling policies, again, I'll come to the financial independence and education part, because without these 10th and 12th, we find that even though that they're capable, they're not able to get placed in dignified positions that give them the basic wage required for sustenance. I'm not talking about huge salary packets. We are talking about, sustenance. They need the money for them to sustain, to eat 3 meals a day, to have a decent place to stay, to have dignity of labor. So I feel that the industry should come forward for the skilled, unskilled labor, the waiving off of the 10th or the 12th for jobs, and going based purely on some other merit. You assess them, you train them, and then take it, and not just a certificate of 10th and 12th. While we should enable them to get it, I'm also saying from the other end, the market should also step forward to support their journey. The second one, I'm sure there are better experts here, but our limited engagement with the POCSO Act implementation. It's something that has been, a cause of a space where there is a lot of angst, and there's a lot of bitter experiences for the women who've been through the system. And when they come to adulthood at 18, they have their own, independent autonomous decisions to take. And this POCSO Act implementation somehow, it kind of interferes with their life post 18 also. So I'm sure the experts would know better here, but this is something that has come about in our limited experience. The last one is like Anjali spoke, government does have a lot of schemes that are available with respect to caregivers. Mission Vatsalya does provide the financial sustenance till 23 years of age. We feel very strongly that if this is something which is absolutely ensured before the caregiver leaves the care space, the institutional space, this would be of immense support to them, right? This 4,000 rupees or 2,000 at the state governments as they have. It's a budget that is allotted for the benefit of caregivers. It is just that it is not very clear how it can be accessed easily by them. So if, as institutions, if this one step is ensured before they step out of care, again, these basic things will ensure that they are able to sustain themselves. Beyond that, like Shivangi pointed out, we feel that they are capable, their capacity is immense, and we feel that they can take off from there with their own strength and capacity. Thank you so much, and I'll invite Ashoka to share her views.
Thank you. Thank you. Mute, Ashoka. You're on mute, Ashoka.
Oh, yeah, okay. Yeah. So first of all, thank you for this opportunity to, which for me, it's more for enriching myself and sharing our experience as far as running the shelter. Women's Interlink Foundation runs 3 shelter homes in Kolkata, Madhyamgram and Jalpaiguri districts for last 20 to 25 years for girl children and women survivors. And the homes have integrated with the government schemes of Mission Vatsalya and Shakti Sadan. So currently we have 3 Mission Vatsalya projects and 2 Shakti Sadan projects running in these 3 shelter homes. So we are all aware of the services being provided in the homes already, which are like care and protection, medical services, legal aid, counseling, recreational activities, vocational trainings. So services are provided with the objective of ensuring physical and mental well-being of the women survivors, accompanied by economic rehabilitation activities, which include skill development and income earning through marketing linkages and also through placements wherever possible. The government also has been helping us in this regard. And the homes also have adult educators to help the women with functional literacy. So all the women have Jan Dhan accounts under which they receive 500 per women. This is above 18 years of age. So they have Jan Dhan accounts under which they receive 500 per month, which they can access later once they are out of the home. And along with this, they are also getting a small allowance of monthly allowance of 300 per month, which while they are not to you, they cannot use while they are in the home, in the institution, but they can use it after when they move out of the home. So this is a good thing. So when we talk of shifts, basically there has to be an acceptance that there is a scope for all of these services to improve further and also be strengthened. So I'll just highlight some of the needs that we feel while the women are, move out of the homes or are transitioning. So first of all, this is like one many women, before that, I also need to mention that many women who are in the uh, homes are kind of they are who come to the homes are in the MR category, and the home is really not equipped to accommodate the special needs of these women. So think as far as policy is concerned, the women with MI and MIR who need focused attention, they should be kind of going to other specialized homes where their needs can be adequately taken care of. Also, the women survivors need an ecosystem of multiple choices for skill development according to their interest and acumen. Like one size fits all cannot be applied here. Also, to make them economically rehabilitate them, marketing support and placement support are very much needed. The next point is, which is very critical and which is, there is a very, this is a big lacuna, which is of soft skills support and training. Particularly, this support is very much needed for the women and girl residents to improve their communication skills. Then trainings need to be there to improve their emotional stability or emotional control, to nurture and sustain relationships at workplace and home, and the home also, generally to prepare them for life after moving out of the home. So this support is very much needed. So also, women need to be trained in their rights. What kind of rights? So they can articulate their needs well, and they can, when they have transitioned, they can live a better dignified life. Also, we also feel the need for designing a special package of services to prepare the women for the transition specifically out of the home, which includes guidance or mentoring while they are in the home itself. So if something can be done to kind of, external guidance, that could be from the community also, to help them to transition while they, yeah, transition out of the home. So that support would be very, very helpful. And finally, also housing is a major issue when the women which the women have to face. So any support there also by way of policy would be very much helpful. And finally, strengthening all the above has financial implications, like other panelists have already pointed out. So this part also needs to be looked into. Thank you. So next is
Leena from Udayan Care.
Leena Prasad, yes.
Thank you. Thank you to the previous speakers. Leena, I just want to say, it'll be nice if you can bring up points that have not come out from your own experiences so that we can have a multitude of points that can be discussed post your presentation. Thank you, Leena. Up to you.
Thank you. Thank you, Suneeta Di, and thank you, Ashoka. Before I answer your questions, Suneeta Di, I must accept that, working with you on domestic violence since I was in Lawyers Collective to sharing this platform on Aftercare, it feels like a full circle. It's such an honor to join this esteemed panel. And I must congratulate Enfold and the team for this so insightful report. It's really heartening, I think, to hear, Dr. Prasad and Rashmi ma'am talk about Beyond 18, which, a few years before was really not spoken about. So in that sense, feels like, yes, we have progressed. For the ecosystem strengthening, I think I'll just share one point, which is in addition to what my previous panelists have already mentioned, so not repeating. Ecosystem strengthening based on our experience can happen only when we start programming, planning, and thinking about aftercare with care levers and not for care levers. So that shift, I think, is really important if we want to strengthen the ecosystem. We have to think with the care levers and not for the care levers, because our work really shows, like I think Ramya also mentioned, they come with huge potential and strength. And despite the trauma, despite the adverse experiences in childhood, their strength and resiliency is something that we really need to bank upon and work with them, not for them. In terms of the policy, improvements, there are 3 points that I'd like to share. One is, what the report also shares about, talks about is the duration of stay and the age limit that we have in the law and the policy till 21 or 23. I think we're looking at global experiences where, recent laws have improved, and there are countries that have extended the age to 25. We heard Anjali and Ramya say that, vulnerabilities don't disappear at 18, at 21, at 23, they remain. And the support that the caregivers are looking for is lifetime. I'll give you one very quick story, recent experience where, there is this caregiver we are in touch with, and she's extremely empowered, independent, mainstreamed. You can use all the indicators for mainstreaming and you will tick the checklist to say yes, yes, yes. But and when she got married recently and she went to get her marriage registered, the experience that she, had to undergo from the tehsildar, who did not understand care levers and who did not understand the entire challenges that they bring with, her identity was questioned by the tehsildar, and it really again pushed her back to trauma. Because she had resiliency, she was able to come back quickly. So it can happen anytime, and that ecosystem where support is extended to her is so necessary, even if you're 35, even if you're 48, whatever that age barrier. So we really need to look at that. Another thing that I want to add is I heard someone say about education. Ramya, talking about education and how systems should really open up to, because we know that in institution education does get disrupted. at 18, they may be in 8th class, they may be just 5th class pass out. And how do you actually meet the criteria for skilling them in vocational institutes where, the minimum is 12th class? How do you skill them and make them job ready? I'll share a good example that recently happened in Madhya Pradesh. So Madhya Pradesh, the government has taken this decision. All the ITIs have lowered down the eligibility criteria for caregivers. So caregivers, even if the eligibility criteria is 12 pass for normal people, young people from community and families. So if you're a care experienced person, the eligibility criteria can go down to 5th class or 8th class. So that has opened doors for caregivers to get skilling and then become independent. My second policy recommendation, Suneeta Di, is a strong one on the need for an aftercare guideline from the MWCD. Over the last few years, we've seen a lot of state governments come up and notify their state guidelines, but there are variations, there are discrepancies. Support to aftercare is not happening in a very streamlined and synchronized manner that it can happen. So MWCD must notify, come up with the national guideline that lays the policy framework on how do you support caregivers. And when this is my honest request, when they do get into drafting the national guideline, or when other states are making guidelines, they include caregivers into that process. That is so important. Housing, I think, is very important because, we were speaking to some caregivers who have married and are successful, so-called successful in their marital life. And most of them said they chose to marry a person from a non-care experience background because they were looking for security. They were looking for someone who owned a house. So housing is so important. I really do not understand why the MWCD and the Urban Affairs Ministry and Mission Shakti cannot converge and provide subsidies and housing security to caregivers across the country. My third point, and I'll stop with this, which I already mentioned, is more focus on caregivers' participation and recognizing their agency, believing in them. They really, I think the report Shivangi spoke about the caregiver networks, and the caregiver networks are a platform. They have really emerged. There are 13 states, I think, so far now in India, which have a caregiver network, and that peer support is magical. We also have the National Caregivers Network that is really building the momentum and, making the caregivers into care leaders. Now, this is the space where caregivers really want to give back to society. They want to pay forward with their lived experiences. And that is something that all stakeholders, be it a practitioner, a CSO, a service provider, the state government, or the national government, they must listen to their voices. One caregiver, told me that it's enough that we've been asking for a seat at the table. I think it's now time that we make our own table. So that, I think, stayed with me to say, really, this is the time that they really have to create their own table. And I must acknowledge Rashmi ma'am, I'm sure she's here. Recently on International Youth Day, she spent an hour talking to the caregivers from Delhi. That motivation and that assurance from senior state governments, when they really go out, talk to the caregivers and understand their challenges and their solutions, is the key to solving caregiver challenges in India. I'll stop with that, and I think I'll pass it on to
Deepali.
Deepali. Okay.
Thank you, Leena. Deepali, over to you.
Thank you, Leena. Hi, Suneeta Di, and really congratulations to Enfold team because I think when somebody is told about my introduction, almost 24 years working in the development sector, and almost after 10 years, I'm hearing about that aftercare and this kind of that research. And that's why it's a feel more important conversations and feeling very honored to be part of this whole conversations and discussion and somewhere looking that so whatever the insights last 20 years I learned through my experiences as a grassroots organization and grassroots leaders. So coming to the point very specifically because the time is very less and I have lots of things to tell. So one thing which I felt is a very important to understand what is profile, what is the children, those who are living in the institutions. Those are the orphan, those are the destitute, those are the single women children, those are unwanted children, those are coming more the marginalized, those are coming from the more that low socio-economic background. So when these children living in the institution, then what's the kind of the approach and lanes we are having towards them? So either that a beneficiaries, either we are looking them as a very charity perspective. So if we really want to talk about the what's the intersectionality visualize we want to see in this approach, जो मुझे एक बहुत बार लगता है it's a need to look at these aftercare young adults and these survivors as right holders, as a co-creators. It should be not only the survivor centric, but it should be the survivor lead kind of the program somewhere. So अगर हम aftercare program की बात करेंगे, तो the program should be designed this way where they know what the best for them. Because they're coming from their life experiences. So somewhere it's a very much important when we're talking about that intersectionality, how to visualize. I also feel it's a very important key, the trauma informs and the very survivor-centric counseling's intervention should be while the children going into that institutions. Because it's a generational trauma and that's a hold it into their body and there's an emotion. So it's not possible कि आप 1-2 साल में जो है you can just trying to fix out this problem through that vocational training, then there's livelihood and that financial management, and it's a lots of happening within them, and it's a very much important to look at that way and to support them. So the healing is a very much important for these children because you are living separately from your children and institutions when they know how the world is actually looking them. तो इसके लिए बहुत काम करने की जरूरत है, and again it's important because there's a very growing stage of the children living in the aftercare home institution, even the women those who are living in the shelter home, who are the caretaker. One is a caretaker, those who are coming with the similar background and not having that expertise, that's a one thing. But definitely they're having that compassion, that's why they're working with the children and survivor. But other thing also, we can't be ignore the way that the institution building the cultural practices in the institutions, because they know कि ये बच्चों का एक अपना social identity उतना strongly है नहीं, कोई बोलने के लिए है नहीं. So that's a way they're building there's a cultural practices, and that's a way they're trying to make that individual identity. Once they go back and reintegrate society, they can be the feel the secure themselves, which is not a completely true. So I think we need to work on that kind of the dialogue with the system. Ki it should be the more, if we are talking about the children coming from the different background, that practices should be the more the secular in the institutions, which is not happening. So I think that's a very much important if we are talking about the intersectionality. एक मुझे और भी लग रहा है कि the loneliness is we need to look at the very different way, because in बच्चों को, in औरतों को ये पता होता है there is a no outside support. So when system is talking about to take care of them, it should be not like that कि आप institution से बाहर गए, then that the knot is completely cut. There's a constant need a support, as somebody said something like the Anjali and Ramya कि follow is important, but that a follow should not like that कि आपके number को टिक करे what you support provided to people, but the follow-up should be like that to check emotionally where is the people and what a kind of the support they require, and create that kind of the platform ki jahan pe they can approach again back to the community and the system ki they need a continuous support. Ki the vicious cycle of violence and that poverty is not easy to that one person can break just having the some kind of the skill. It's a constant need that emotionally, mentally, and kind of that social protection. तो उसके लिए भी जो है it's very much important to हम उसको देखें. In context of the policy, I think Ramya already said the Vatsala mission. What I experienced, the system is working very in isolation. That the system, so I think that's very important. Ki system should be the take care of that holistic intervention required. It means that every department, every system should be the aligned with each other, and then that's the survivors and that the children can get a support. So वो मुझे लगता है कि it's very important. I feel it's काफी ज़्यादा yeah, just give it a 30 second. I think in whole my conversation, I'm putting that a social identity. It's very important to acknowledge the caste, gender, and the other inequalities. So whenever that system is building some policies, it should be the more extra efforts should be need to take care while the working and the rehabilitation of the children.
Very important. Srilekha ji, would you like to add your thoughts in 3 minutes, please? Thank you. We can't hear you. You're muted. She needs to be unmuted. Can the organizers unmute her? I'm sorry. Srilekha ji, I don't know. Can the organizers unmute her, please?
Yes, we're trying, Suneeta.
There, Srilekha ji.
I think she will need someone at her
Yeah,
end
she needs
to
someone at her
press
end.
the unmute button.
Yeah. Thank you.
Sorry, it got stuck. I'm so sorry about it. Thank you very much, Suneeta, and all the esteemed panelists. Unlike all of you, you were all professionals talking about the subject. I am basically a housewife taking care of the children. So my attitude towards the whole thing, it's so nice to hear all of you with your recommendations and all that. But my way of working is taking care of the children, and as a mother, how I deal with them. We are basically a childcare institution, and from the childcare institution, they are shifted to the aftercare. It's only the residential area that they're shifting. So we know these children very well, and we try to accommodate them. And in most of the cases, the problem which we generally face is the child welfare committees where they say they have to go home, which I personally don't agree. They have to be in a position to be able to earn their own living and know how to deal with life when they go out. So that is the engagement which we have to do. That is how we have to train them. And that is basically what my suggestion is, that the child welfare committees should be sensitized to this area, and only then we will be able to, we can partnership with them, and we can sort of bring out a better atmosphere for the child to grow up. Most of the time when they go for the reviews, the child is crying, and I am trying to fight out and say that no, the child needs some more time. When they are halfway through their graduation also, I have found the child welfare committee says no, they can go home and then they can support themselves, which is personally I mean, it's not a right thing to do, because once they go home, they don't have the facilities to continue their studies, and it's not right. Let them at least graduate, get into a job, and then we will see. And most of the time, when after graduation also, we find that a child totally orphan who has no support system, we have to support her for some time, because immediately as soon as they get into a job, I don't want to throw her out, because we have to make sure that she's comfortable in the workplace and she has enough savings for her. So that is basically what I would like to do. I mean, as a childcare institutions, we have to have these CWCs to be sensitized to all the other things. Of course, the policy making and all that is totally different. So I'm not an expert on that. And actually, I would like to thank Udayan Care, because many of our girls are getting a little extra coaching in computers and recent developments in the computer skills and all that, and they are able to get into jobs very easily. So recommendations is, I don't think I am really going to do any recommendations as such, but let the child be in the institution irrespective of the age, till the child is in a position to go out and meet. And of course, we try to teach the children how to go about it, how to deal when, especially when they are going out into the work, how they have to deal with their employees, how they have to be with the colleagues and all that. So it is a trauma for them, and unless they actually settle down, it is going to be difficult, and without our support system it will be very, very difficult. Now, in spite of all the children going out after their getting jobs and all that, we do try to find matches for them and try to settle them in life, because that is something which, at least our Indian culture, is that when we feel a girl child needs to settle properly. And anytime they have any problem, we ask them to come back. We tell them that we are there for them. So that assurance actually gives them a lot more confidence than the confidence which we have tried to build up in their formative years. So that
Thank you.
way, we
Thank
recently, just 2 days back, we had performed a marriage here, and all the older children had come, and it was such a lovely time we had with the children,
Yeah.
you know. So
Thank you.
seeing all our older children come with their children also, so it's a pleasure actually. So
Thank you.
beyond
Thank
that,
you.
I don't think I am going to talk anything about
Yeah, it's okay.
policy making. Yeah.
It's
Yeah.
okay. Thank you so much, because I think each
Yeah.
of you have resonated common principles, common values, common processes, a
Yes.
common framework of rights, advancing agency, not building on victimization, but at the same time thinking of the cruel, difficult world outside, and therefore supporting the transition journey with institutional care, with support, with resources from the government, with partnerships. And I think we've learned a lot, but also most primarily the community that's affected of survivors, be their children, be the adolescent, be their women across the intersections of caste, gender, ethnicity, location, to be involved in the process of shaping what these institutions should look like. So I think there are a lot of common points, and I must confess, your study opened my eyes to a new terminology, care leaver. I did not know about it. Ramya, you spoke so beautifully about it. Srilekha, you said you're just a housewife. No, you're not. You're doing a fabulous job in creating a
No,
family-like, safe environment for everybody.
it
The
is my children.
Yeah, they are your children, of course, but I'm just saying, to create that culture of empathy, support, and yet respect and a non-judgmental attitude. There are some wonderful comments by Ashika that are coming up. I'm not going there. There are also wonderful questions. There's a very critical question by Bharti on the fact that should the CWC continue to do the aftercare once children have become adults. So there are many such conundrums, or as you have mentioned, the Enfold member has. But you've also highlighted very clearly that we're not looking at protectionism. We're looking at liberating. We're looking at people being fearless, children being fearless, being free, but yet responsible. And I think these are very important values and principles. But at the same time, to put the entire burden on one individual organization to do it all is something we will have to look at. Just like you're looking for convergence and across the government schemes, ministries, resources, which is something many of us have been working for a long, long time, looking for SOPs for the implementation of guidelines and making sure they follow the human rights standards. Leena, you talked about it. Deepali, you've talked about the right to housing. Anjali, you talked about so many of these rights-based principles and the follow-up that needs to be done. I think that you have covered to some extent point number 2 in a small manner. And if you don't mind, I'll open it up just for a few questions and then we can do closing remarks. Is that okay with you? Do I have another 10 minutes, my friends of Enfold?
Yes, Sunita. We'll wrap by 3:40.
We will wrap by 3:40. So I'll open up for 3 minutes for any questions that may come. Please identify. Just put your hand up and so I can see you, because I also have a smaller screen. And then I will ask each one of you for your closing remarks to just say something you haven't said, because there's a lot of points. I've not been able to summarize them all, but just to highlight that this is a huge task and how can we create a continuum of care and support, even with the networks that we have created and working with each other. Yes, please. Anybody with questions out there?
Ranu is asking, I was wondering how would follow-up for long-term and lifetime look like unless there's a mentor that is instituted for a long term, because staff keeps changing in institutions, there's need for emotional bond and support, and children need that kind of support, as was very rightly said, that those that are orphans and don't have biological families or other families that have adopted them, foster families. Then Bharti's question I have already read to you. Then we have a question about why, earlier there was a comment, I'm not going to read it entirely, but the comment by Ashika, I think, was to Ramya. You know what Ramya was meaning to say is that let's look at giving the best we can, but we're not asking for the whole world, we're asking for our share in the world. So your question was literally, why are we asking at the lower end? Maybe we should ask for our rightful end. So that was your question. So let me open it up. Are there any other questions? Oh, there are questions on the methodology of the study, which I'm not going to take up in this panel. We are talking about non-judgmental attitude in the text, and that independent living requires a lot of support, and how inclusive care homes and aftercare homes need to be. Okay, I'm going to open it up because I don't see any hands that have been put up. So let's start with you, Anjali, and then I will call each one and we can then wrap it up. Is that okay, Anjali? To some of these questions and any thoughts that you may have left out.
Sure.
2 minutes? 2 minutes each, please.
Right.
Thank you.
I think one thing that was asked in the question was that because there is constant change in the staffing and how one can really, get the support on a long-term basis. What we right now practice, and of course, would be very helpful to learn from other panelists as well, is that we have a common number. So it is the phone number, the helpline number that we run. So Shakti Shalini runs a 24/7 helpline right now. And so when they call us, and whenever the counselor, whosoever is the counselor, they may not be the person who was supporting the person earlier. So we have like a tracking sheet, like an entire database of survivors. So whenever they reach out to us, first is that we always ask them, have they already spoken to someone from our organization? And if they remember the name, it's always great. If they don't, then we go back into the database to check that when was the last time that they spoke and who was the concerned person. So usually, I mean, luckily, if we may say that the attrition has not been so much, and we have counselors who have been working with us for over 10 years now. So that kind of helps us to maintain that sort of support. But even when because of certain reasons there are changes, then the counselor, before giving a call to the survivor, it is important for us to read their files first, so that whenever we are having a conversation, it's not like absolutely new to the person, and they have to run the counselor through the entire conversation and the the support services that they had taken. So this is what I would like to take up right now. And I think for my closing questions, I think it's important for us to look at aftercare as a political work and less of a welfare and a charity work. It's important for us to build more feminist solidarities that will eventually bridge the gap between this personal and political divide that we always talk about. Um, and I think someone in the panel mentioned that, I think it was Deepali, when we said that survivor centric se zyada survivor leadership pe jate hai. So that leadership is the key. So if we keep even these two things in mind, that what we look at, like how we look at aftercare and who are actually the leaders in this, I think the game will start shifting a lot. So these are my remarks. Thank you.
Very well said. Anjali, you've got a flurry of appreciation, which you may not have seen on screen, but very well said. So if there are other principles, Anjali's also already said 2 principles, you can build on them. Leena, would you like to go next?
I think, yes, I already mentioned the most key principle, I think, when you work with caregivers is listening to them. And actual listening, I mean, not tokenistic. And, giving them the agency, and whatever you do for them, please consult them so that they go own their, life decisions. I think giving them life skills is the most important thing we need to focus on. And
Leena, can you just answer this question? I'm sorry to interject, but there's a question that says there's a lot of hyper focus on girls' empowerment, and there's a backlash and discrimination that's being seen uh, because there is discrimination and leaning towards a manosphere culture. So it makes it harder for these girls to navigate through life. If you can answer that as well in whatever you're saying. Thank you.
Yeah. Thank you. So I think, also Ranu's question, let me pick that up in terms of, when she said, uh, how do you follow up with them for life? At Udayan Care, and the report talks about it, there is this very innovative thing that we've done is mentor parenting. So mentors for life. And we have research and evidence that shows that, the presence of one single person in the life of a child who the child or the young person can trust is, is enough. Just one person. And at Udayan Care, currently we have about 1,500 caregivers that we are directly supporting in many states. And we are constantly struggling to look out for mentors to support them.
Yeah, okay.
There is one CWC chairperson, who agreed to be a mentor in Delhi. And she now says that more than changing their lives, I have changed as a person, because they bring so much of learning and compassion to me. So my life has changed. I would really call out to all the participants on this webinar to say, in case you want to directly mentor a care leaver, please get in touch with us. We're really looking out for mentors. And one care leaver's life that you can change, I think we're doing a great job on that. That's the mentoring one. On Ashika's question in terms of the gendered approach that we need for care leavers, I think I'll only say that, recently with the married care leavers conversation that we were having, it showed a lot of gendered discrimination. They think so differently. And we definitely, I think we shouldn't be leaving anyone because, when we were wanting to understand choices that they're making as parents,
Close.
Just 30 seconds. Most of the caregivers who were females shared that, parenting decisions were taken jointly by the entire family. Most male caregivers said that they were taking the decision when it came to parenting choices. So that shows a lot of, difference in approach. And I think aftercare and the support with caregivers is still evolving in India. So let's give it some more time. And I'm sure we'll do a brilliant job in terms of solving for all issues and challenges.
Yeah, my apologies. I think every webinar has limited time. So I'm sure there'll be many more follow-up. Ramya, you want to give some of your closing remarks? And
Yes.
I think Enfold has given me only 2 minutes more. 1 minute. Yeah. Can I take 3 minutes so I can have my 3 speakers give their closing
Yes, please.
quickly.
Yeah. I have only one point to make, which is the autonomous adulthood of care leavers. This is something that we struggle as a society. It's not unique only to care leavers, because our children grow up and they are adults and they are 40, 50, but still they may be treated as a child at home. But the fact with care leavers is that their regular life experiences are absent, their support system is absent. So the jump that they have to start from here and jump till here. Whereas a youth from a supportive environment will have to jump from here to here, and there is always a family or a support system to catch them when they fall. For the care leavers, the jump is huge. So we are always focused on how do you build this autonomous adulthood of the youth, which means that we start treating them as adults. We start, like Irina said, their agency into question. There's room for them to make mistakes and learn, non-judgmental, no moral policing. Allow them to grow as adults. And this has to start from the age of 14 or 15 to transition them. At 18, suddenly the next day you won't become an adult, right? So it has to start from 14 or 15. That would be my point.
Fantastic. 1 point, Deepali. 1 point from you. Just one sentence in 1 minute. My apologies.
No, thank you. I completely understand. So I'm not taking care of the questions because I know the other panelists already take care of the things. I just want to put one things related to the policy and the accountability, because I feel it's a very important, and somewhere the Anjali already mentioned, the funding and the resources is very much important. If you can see that's an aftercare home and that what's the gender budget is a government is allocating for this kind of that youth development and the children, those who are living in the institutions. There is a, if we really want a true participations, then it's required. It should be the government, not only the inviters, it should be the government involve us in the decision making, developing the program. The government should be the have the accountability if they're not running a program. So kind of that peer pressure where kind of the system should be the more important, which I'm seeing not having in that most of the state. At least Maharashtra, we seeing there's no aftercare home for more actively run for children's and the shelter. There's no committee for those who can monitor the things.
Yeah, thank you. Thank you. Ashoka ji, would you like to give a closing sentence? Okay. Yeah, I see you. Yes, please. One closing remark. You're on mute. You're on mute. We can't hear you. Oh, sorry.
Thank you. Thank you.
Yeah, thank you for all the panelists and you too, Swagata, for brilliantly moderating this. And really, I learned a lot in this discussion. And the only thing I like to say is that hand-holding support for transitioning has to be strengthened further. And we have to find out ways how this can be done so that you know, they are able to lead an autonomous, independent life without fears, without being judged. Yes.
Thank you, Ashoka ji.
Thank you.
Srilaka, anything, would you like to say anything? One sentence, may please.
Yeah, just, I mean, one thing which about the gender, actually, I would like to uh, teach my children how to face the world and not feel that you are a woman and of a lesser value. You have to compete with elders, with all men, and don't feel that you are somebody, a second class citizen or something like that. So you have to work it up. And I'm sure most of our children are doing very well about it.
Yeah. So equality, autonomy, freedom, respect,
Yeah.
affirmative actions, partnerships, allyship, also looking at the misogyny in our world and the patriarchy and the caste-based discrimination and other forms of discrimination, ensuring our institutions and internally all the staff address it, and also looking at transformative shifts that need to be made. My last sentence to Enfold and all of you participating as well as the participants, please develop a policy note of what can be done in the short term, in the medium term, in the long term, and also cost these exercises. How much would it cost to do this? Otherwise, they use old financial models, which is, okay, per day, so much cost for a resident in a shelter. And residents come and go. Somebody stays for 8 days, somebody for 5 days, somebody for 6 months, somebody for 3 years. You can hardly have an understanding of how to cost. So please develop a financial costing model so that we are able to tell them to put their money and their resources and their partnerships for the communities that most deserve it. Thank you very much to each of you. My real apologies for kind of compressing time, but I'm sure there'll be another one. Thank you, Swagata, Ranu, and friends from Enfold, Bharti particularly, and to UNFPA. Thank you.
Thank you so much, Suneeta, and all the panelists. I think we had some wonderful insights. And we are also running a little late. So we'll now quickly move to the next segment of the program. So we have Gopika with us to present the highlights of the report related to childcare institutions. Gopika is a legal research associate at Enfold. She has a degree in law and development studies. She worked for several years in the field of labor law and is currently involved in research and laws concerning child protection and juvenile justice at Enfold. Over to you, Gopika.
Thank you, Ranu. My colleague Shivangi has already covered the section of the report which pertains to aftercare facilities and shelter homes. I will cover the section pertaining to childcare institutions. Next slide, please. Shivangi had already covered the methodology followed through the study. This is a list of CCIs that were covered under the study. Under the first category, we have CCIs managed and run by the state government. We covered Sanskar Ashram for girls and Sukanya homes. Under the second category, CCIs managed and run by CSOs. We covered APSA, Bosco, Don Bosco, Sneha Sadan, both the girls and the boys home, and Asha Sadan. Within this category, we have a subcategory. SOS follows the foster care model. The third category is cottage homes. All of the other institutions, except the cottage home, are registered as CCIs under the JJ Act. However, the Matrikol cottage home run by Domkal Vikas Kendra is a cottage home established under the cottage scheme of the government of West Bengal. I also wanted to add that given the varied nature of circumstances, different districts, states from which the child might have come from, the stay can extend from a few weeks or months to even several years. As a result, while the basic services provided to children in all of these institutions are the same, such as food, clothing, shelter, medical care, psychological support, counseling, the education and skilling programs differ for children in short-term care and long-term care. Next slide, please. Institutional rehabilitation of children rests on two pillars. One is the continuum of care, which Anjali also mentioned, and the other is individual care plan for every child, which includes the follow-up on children leaving institutional care. We also asked what institutions thought about rehabilitation, and here are two responses. For example, a staff member of Sukanya home emphasize safety as a core component of rehabilitation. That is an environment which is free from fear. And a staff member from Asha Sadan emphasizes that interventions need to be tailored to the specific needs of each child. Next slide, please. As mentioned, there's a recognition of continuum of care for children in difficult situations as they navigate through the different stages of development. Besides age-appropriate segregation of children, efforts are made to provide age-appropriate nutrition, healthcare, and education. For the age category 14 to 18 years old, there's a focus on basic needs and safety, assessment and care planning, education and other skills, psychosocial support, participation and development. And this point of focus shifts as they grow older. Next slide, please. We have seen examples of good practices across institutions. For instance, in the context of child participation, a representative from APSA shared that they involved children in discussions with the architect while designing the building. In Bosco, once a month, a day set aside is a bell-less day, during which children plan their own program, and at the end of the day, they do an evaluation to understand how they spent their days. Most CCIs also have children's committees, and both APSA and Bosco have constituted children's parliament where children decide on matters of importance to them. They discuss their concerns with the staff and find some solutions to their concern. Next slide, please. So if we were to look at comprehensive rehabilitation, we have several components that make up rehabilitation, from mental health to relationships, education, vocational training to life skills and follow-up. Next slide, please. We also interviewed former residents of CCIs to understand what they felt that the CCI helped them in their rehabilitation. For instance, a former resident of Guild of Service said Guild of Service really helped them develop a sense of self-reliance. So taking a stand for myself and being self-reliant. A former resident of Domkal Vikas Kendra said, because the cottage home exists, many girls like me are able to get an education. I studied and that's how I got a job as a SSA Aya. Next slide, please. Now coming to replicable practices, I just want to add a disclaimer that this list is not comprehensive, that multiple CCIs have adopted good practices both within these categories and outside of these categories, and these are just some of the examples. Aptitude tests are used to guide educational and career choices. For instance, This is adopted by organizations such as Asha Sadan, SOS, Sneha Sadan. They conduct educational assessments, and they also make sure that the needs of children with disabilities get taken into consideration as well. There are inclusive, innovative, and flexible schooling options to meet diverse learning needs. For example, Asha Sadan APSA enrolled children in the National Institute of Open Schooling. Sukanya adapts its curriculum to support children with disabilities. In Guild of Service, older girls tutor younger girls, and they also receive a stipend for doing so. Most CCIs also have vocational training facilities. In particular, Don Bosco, for instance, runs a non-formal technical school for boys. Bosco runs like a residential vocational training institution. Under family-like care, groups of children are cared for by foster or house parents. For example, SOS, the house mothers and house fathers. On the other hand, Sneha Sadan engages married couples to serve as house parents. In terms of peer support, Sneha Sadan has alumni who mentor current residents. Asha Sadan has older residents who orient newcomers. Guild of Service, senior girls accompany younger girls during their daily routines, such as meals. Children are also given assistance in accessing relevant government schemes at CCIs. For instance, in Domkal Cottage Home, children are linked to schemes as Kanya Shri. Asha Sadan facilitates compensation under the Manodaya scheme. Sanskar Ashram provides assistance with obtaining identity documents such as Aadhaar and the PAN card, which is necessary for accessing some of these schemes. Next slide, please. Now, if we were to look at some of the challenges and recommendations, with those specific to access to education, there's uncertain duration of stay, lack of essential documents that hinder access to education, discrimination in schools that affect self-esteem, while those who have never attended schools or dropped out struggle to cope with formal education requirements. The recommendations pertaining to that is ensuring education continuity through post-restoration planning, inter-district coordination, facilitating access to identity documents and schemes, linking children to suitable schooling such as regular schooling, bridge schooling, and training on inclusion in schools. Next slide, please. Now, if we were to come to some of the challenges pertaining to safety, autonomy, adolescent sexuality, there's a concern that is expressed often for the safety of school-going children, especially girls. The proposed recommendation is the provision of school transport, escorting children, enrolling them in nearby schools, and conducting workshops on personal safety, sexual and reproductive health for staff. We have also found that adolescent sexual exploration is often seen as abuse, leading to strict surveillance and restrictions, including practices like tracking the menstrual cycle of girls. This calls for a dialogue with adolescents in order to build their own decision-making skills, but also calls for wider understanding by the child protection system in light of domestic and international standards. Now, if we were to look at the administrative and operational challenges, there is a cumbersome procedure and approval requirements that affect the timely release of funds, and access to funding for group foster care or other innovative forms of CCIs are challenging. The recommendation is flexibility in funding and administrative norms with accountability mechanisms. There's also a challenge of overburdened staff who have to deal with the emotions of children with trauma. The recommendation is the selection of staff with this aptitude for this kind of work, incentives, peer support, and role clarity for staff. Next slide, please. While the report has a more detailed set of reflections on the way forward, I want to leave you with some of these reflections. Various components of rehabilitation fall under multiple departments. How can interministerial coordination and convergence of services be ensured? What steps need to be taken to equip staff with skills for positive disciplining? How can principles of universal design be implemented, and how can assisted living programs be strengthened to ensure accessibility for children with disabilities? How do you negotiate protecting children from harm while advancing independent living skills and respecting their autonomy? Thank you. Over to you, Banu.
Yeah. Thank you so much, Gopika, for the engaging and enlightening presentation. We now move into a second panel discussion, which will focus on future directions for childcare institutions. The session will be moderated by Ms. Bharti Ali. Joining her on the panel today are Sheila Devaraj, Father Ashok Lingampalli, Father Wellington Patel, and Anuradha Abrol. I'll briefly introduce our moderator and each of the panelists. So our moderator is Bharti Ali. Bharti is a development professional who has worked on gender and children's rights for over 3 decades. She has been part of several government and non-governmental bodies as a child rights expert, contributing to development of law and policy, research and training, particularly on child protection and access to justice. She is currently one of the directors of Help for Children in Need Foundation and an independent consultant with different organizations, including Enfold. Next, we have Father Ashok Lingampalli, Director of Don Bosco Navjeevan Girls Home, Telangana. He holds an MA in journalism and a BA in mass communication. An experienced media professional and academic, he brings over 15 years of leadership experience in media direction and production. Next, we have Sheila Devraj. Sheila has more than 38 years of grassroots and advocacy experience working with urban poor, women and children, government and legal systems for child protection. As the director of APSA, which is Association for Promoting Social Action at Bangalore, she guides the programmatic and administrative functioning of the organization. Our next panelist is Father Wellington Patil, the Director and Trustees at Sneha Sadan, Mumbai. Father Wellington Patil is a social worker by training. He has worked with children at Nashik Sudhar Grihalay and Baikula Under Trial Prison. He has also worked with REACH Education Action Program, focusing on non-formal education for urban and rural children from socioeconomically weaker sections. Lastly, we have Anuradha Abrol. Anuradha is an accomplished human resources leader with over 25 years of experience across diverse industries. She currently serves as Chief Program Officer for the Family Life Care Program at SOS Villages in Delhi. Thank you to all our panelists for joining us today. And I'll now pass to Bharti.
Thank you, Ranu, and a warm welcome to all the panelists. Also grateful to Enfold actually for taking this up at a time when people are actually questioning the institutional care model for very many different reasons. We'll not go into that aspect because we do have some excellent practices that were documented in the course of this research. And I think the idea of this panel should be focusing more on reimagining CCIs as we look at the way forward. Um, Keeping in mind that the childcare institutions have actually been in a very complex phase of development all through, in the sense that we've been talking about balancing protection and autonomy and considering or at least recognizing the evolving capacities of children, um, plus legal compliances that actually act as a weapon on the CCIs most times. So we have to, looking at these complexities, what is it that we've been able to achieve despite the complexities is I think the strength of the panel here today. Um, as Suneeta said, I don't think I should be spending more time on what I want to say. We want to hear from you, each one of you. So the format of this panel would be that I will have some questions to each one of you, which is probably specific to some of the practices that are documented in the report from your organization. And then we move on to some more generic questions, which will again be put to all of you. And with the request that please stick to the time limit of maximum 2 minutes per speaker. So I think my first question, I'd like to go to SOS Anuradha. Uh, You and Sneha Sadan actually follow the family-like group care approach, which is akin to the group foster care, which the Juvenile Justice Act talks about. Yet it is not group foster care, it is still a CCI. So, how well does that approach work for a CCI? What are the possible benefits of such an approach? What are the challenges? And what elements of this model can realistically be replicated? If you could give us some thoughts on that.
Yeah. First of all, good afternoon to all of you, and to my welcome to all my distinguished panel members. Thanks for the opportunity, Bharti. Uh, so basically, as I said, in SOS we have a group foster care model, which although SOS is a childcare institution, but it is a very uh, unique aspect or a uniqueness in its model itself, wherein a child belongs to a home which has got a parent, a mother to take care of the child as a model. And then there is a concept of there are 8 siblings, there are 7 siblings of the child, so the 8 children maximum under a mother who's a parent. And these children, they form lifelong bonds. So if we talk to any mother or any child who has belonged to this house, like the care leavers we're talking about, aftercare, so they have their brothers and sisters who have been with them in that home till the time they moved out of the care of the organization. So they have a sense of identity with the parent, with the person, with that family. The brothers and sisters are there. So as a result, first of all, there is a feeling of belongingness. So it is not just a CCI giving, food, water, shelter, but it is more to that. There's a sense of belonging, a sense of bonding and connection. And there is always an adult figure in the life of a child, which is the mother or the youth father, who the child can always connect to and be connected to, even when the child has left the care. So that is a very unique part of it. And uh, in terms of the entire institution is there to take care of the child in terms of the development aspect, the child development, which is the key cornerstone, holistic development of a child, of our SOS model. So this actually helps in twofold manner. First of all, there is a continuum of care, which we have talked about earlier in this discussion. There is in aftercare also, there is a mentor. The not only the co-worker is there, but also the mother or the youth father is there as an emotional connect. Then there are brothers and sisters. And when the child starts living independently or outside the system, outside the CCI, then also he or she has brothers and sisters to connect with. So there's a care levers, informal connection is there always to support each other at the time of need. And many a times we have seen that many of them, they are settled so well and they always support each other. So I would say that this is a very unique model, which ideally it is replicable very much, and it really gives a very a sense of, that a child feels that this is my home. Now we have started also, we have models of group foster care under the institutional care, but in the community. So we have individual houses in the community. So the children from many CCIs, they have come to this centers, and they feel a sense of, a sort of sense of equality in the societal system, that we also have a house, we have a mother, this is my house, this is my brother, these are my brothers and sisters. So there is a total, you can say, a mental and emotional connect with this entire ecosystem which is created for the children. So that's what I have to say for it. Thank you.
Thank you so much, Anuradha. And that's so important because, in fact, there's a question that's coming to my mind for each one of you, which I had not planned earlier. But as you speak, Anuradha, it came to my mind. The children from your institution, when they go out to school or wherever, how do they introduce themselves? I mean, what do they say? Where are they coming from? Where do they belong?
They
Anyone?
was just introduced they will just introduce themselves with their name, and the mother's name will be the house mother's name, and my mother's name is so and so. And they go to regular any other school, or any other, not regular government schools or regular public schools, depending upon the child's capacity and capability, and also the time the child comes into the system. So there is an identity that I have a mother whose name is so and so.
So that's the connection which the child establishes for life. And even they're
Right.
connected to the mothers who retired, they are connected to the retired mothers also. And there is a parent, always a constant figure in their life.
Right. So at some point, I'd like you all to also address this question of stigma, because that's something which has stayed with me while doing the study. In some of the institutions, the girls did say that that stigma attached to being in an institution or coming from an institution is something that takes a toll on their mental health constantly. So we'll deal with that, but we'll also move on to the next question to my next panelist, and that would be Sheila. And I'm so happy to see Sheila after many, many years from APSA. Sheila, we've been talking about children's participation in managing their own lives. And in the childcare institution model, the space for participation actually shrinks because protection takes over participation. So, given your experience with Children's Parliament, with other forms of participation, um, how do you see participatory governance models like this being institutionalized in all CCIs? What would be required, to bring that change, ensuring that children have a genuine voice in shaping their environment, maintaining safety, accountability, discipline, while exercising their autonomy and choice?
Thank you very much, Bharti. Um, See, it's very important to have a children's committee within the children's home. So if you ask me, we have a welcome committee. The welcome committee talks about how to bring in a new child. So when a new child comes, there is a child or a children who brings in the child inside the home and introduce the child to various other components. So the child participation starts from there. So we talk about how important it is to see how comfortable is the child is. So we have a children's committee, a welcome committee where the child brings in the new child, introduce the new child to the different system that is existing in the children's committee. So this child will introduce and talks about all the committees that we have. The children's meeting that we conduct is conducted every year, week. Every week, the children's meeting is conducted with adult representatives. So there is a lot of inbuilt system when the children conduct the meeting. They talk about the parents, they talk about what is the care plan, they talk about how long am I going to be there, they talk about what are the facilities that I'm getting in the institution. So the structure of the participation of child is involved from the basic. So when we started the organization, anything that we do in the organization, we talk about what is that you want, whether it's a classroom, whether it's a building, whether it's the food that they eat. So even the menu is designed by them on a monthly basis. So the menu is given to them. The management of the store is given to them so that they know what are the facilities the organization can afford. They cannot ask for sky and the moon, but they will know this is our limit, and this is what the organization can facilitate for them. So they talk about what menu they want, and they talk about when they are sick, what menu should be given. So we're talking about a welcome committee. We're talking about a children's committee who talks about the parents and how often the parents should be coming in to talk to them, to have a meeting with them, and how often they have to use telephone to talk to their families. And we were very open. I think we introduced this telephone booth in our institution where the child can just pick up, put a 1 rupee coin and talk. And I'm talking about the days when the telephone booth existed. And we really don't mind if the child is talking to anybody, because that freedom is very important. Even if she's talking to somebody, we don't want the child to be talking, but that space is there where she can talk and then feel fulfilled. And there is a simple monitoring system which we also see. We also say guide them into how what is good, who you should be approaching, somebody who is not appropriate for you to interact, shouldn't be interacting. So various system like this we have produced. So we have children participating even in what they want in the institution, the protocols, where it should has to be displayed, should be in charge of it. And if you see, then another system in our institution is also how we keep our adult space open. So most of our adult space is transparent. It is never locked, and we don't have any lock and key. We also keep it open so that they can see us and approach us. So from the executive director to the lowest person, the child is free to go and talk, share their grievances, share their happiness, share all that they want to talk. So that there are different strategies that we use. One is where the child can talk about what she wants, he wants within this thing, and also how they would like to have the parents meeting, what type of education they would like, whether it's open school, or the different type of system. So different stages, we have different strategies, so the child will be able to use it. And once they are handling the situation, we feel that there are less of difficulties, the challenges we face, the challenges adults face. There are difficulties sometimes when the wrong menu is given, and then the next day in the meeting it would come that today they did not cook what was in the menu. So a lot of things like this helped us learn and change as adults within the institution. Until today, we are learning and learning to see how open we can be, how empathetic we can be into looking after the children, and um, how much freedom that the child is looking for. And one of the very important aspect that we do is constantly having parents meeting, the link between the family and the child. And we are very confident, we can tell that we have restored several children back home in spite of the difficulties that they had because of this uh, child and parent linking what we do regularly.
Right,
Thank
right.
you.
Thank you so much. So it is a combination of various things, that works. See, I'm aware that all of you have been working on children's participation and enhancing children's participation in your institutions, and that's part of the requirement of the law as well as the National Children's Policy today. But how does it pan out on ground is has been a challenge for a lot of institutions. So I'm sure there's lots to learn from you, but I just asked Sheila this question because that model stood out, and we'll move to the next question. um, while we talk about children's participation, we are also looking at issues of skilling, of education in CCIs. And one model is of vocational training coming from Don Bosco. And the other interesting model, I'll come to that, Father Wellington, I'll come to you after Don Bosco. But my question to Father Ashok at the moment is that when it comes to skilling, particularly in an institution for girls, there is also a tendency to, stereotype the kind of courses that are offered. How do you break that, and how do you ensure that despite limitations, because we understand that CCIs do have limitations in also deciding on what kind of courses to initiate given the limited budgets, the capacities, but how to ensure that the courses that are offered are also gender transformative? And could you share your views on what models uh, you have been using?
Yeah, good evening, everyone. So I'm Father Ashok. So uh, I am trained in media, but this is the first time that I am interacting with a lot of youngsters in my centers. So I am the director of Don Bosco Rehabilitation Center, which is based at Hyderabad. So we have 4 centers, one in Nampalli, the other one is in Ramantapur, the third one in Hayatnagar exclusively for the girls. So right now we have 52 girls with us. So the girls going to school, girls going to college, and girls are into vocational training, right? Yeah. So interacting with them, and then I came to know that some of these traditional vocational trainings are not really helping them to cope with life's realities, especially to get settled as far as their financial status is concerned. So therefore, so I just explored, and then also trying with some of my girls over here, and then I'm able to see a little fruit in that within this span of 4 or 5 months that I am there. The first thing is that digital and technology based courses are very useful for the girls. So I already sent 3 girls, and then they are picking up, and then even very good job offers are there for them. First thing is that digital marketing is very very suitable for the girls. So because these days girls, they can't roam around as the boys do. So therefore, digital platform is something that they can embrace as a kind of career, and that will fetch in a lot of good things for them. Of course, they need to follow certain criterias there. The digital marketing is very very useful for the girls, and I have sent 2 girls this year, and they are really doing well. Probably next month they will be job placed. So what do you mean by digital marketing? It's a very broad term for all of us. The thing is that learn social media promotions, online branding, and freelancing. So therefore, this is where they'll have to really apply their mind and heart to the subject, and certainly this will become a beautiful career for them. And the other one is graphic design. So now you see Canva. Canva is a free app for everyone, but at the same time, it doesn't give you all the permissions what you want to do on Canva. Now to learn Photoshop, earlier. So being a media person, I know that. So it's a very tedious process of learning Photoshop or video editing and all that. But now Canva is a very user friendly, and then if they can apply their mind and heart and a little bit of skills in designing and all that, so there are a lot of opportunities out there. They can even create their own designs and sell to Canva itself, and Canva gives them a sort of remuneration basing on the quality and the kind of impact the poster that is going to make on online. Yeah, no? So graphic design is another thing that girls can pick up. Yeah? And the third one is office automation. Office
Sorry,
automation.
sorry to interrupt here,
Yes, ma'am.
Father Ashok.
Yes, ma'am.
I think my question was more to understand how do you decide on, who decides on the courses to be offered? What are the challenges
Absolutely.
which are
It's,
so
it's the it's the child. It's the child
specific?
who decides the course. We only have a sort of career guidance classes for them. Hello,
Right. Yes, I can
ma'am.
hear
Can
you.
you
I
can
can
you
hear
hear
you.
me?
Yes,
Yeah,
yes.
because right now I am in a district called Nirmal in Telangana. So I just had a meeting with the collector with regard to de-addiction center. So I think there will be some signal issue, but I'll try to answer your question. Yeah. So ma'am, here it is not the management that decides what the child is supposed to do, but we have a series of career guidance classes wherein they listen, they understand, they question, and then they pick up the trade or whatever subject that they are interested in, like, yeah. So
Right.
now
But
we,
if
yeah,
we if we have to say that, I mean, the digital courses is what you would want the girls to take up, given the challenges they have, as you mentioned, that probably they're not able to. There are movement related challenges, safety related challenges, and therefore you or have offered digital courses to young girls. but there
Yeah.
is a larger question of, and particularly for girls in CCIs, as to how,
Mm,
why should their options be restricted because there are some other things that are probably not working well. Um,
mm.
and how do we resolve that conflict?
Yeah.
It's
So
a it's a larger question.
there are so many options, ma'am. I'm giving you just one option, that where some of these girls, they have maybe liking or passion towards digital media and technology based courses. Yeah. So therefore, sometimes, now, we talk about a lot of policies and systems, but one-on-one conversation, we will come to know their aspirations, their dreams, and all that. Yeah. So now their dreams, they begin in a very small way, but as they grow up, the dreams also take different turns, different twists they experience. So that's where they will probably start understanding the importance of career, the importance of education, the importance of picking up a skill that would give them happiness and joy in the future course of their life. Yeah. So that's where, so therefore we have constantly, we organize uh, career guidance classes for our girls. Yeah. Maybe once a month. Yeah. So sometimes even twice a month. Yeah. So basing on, sometimes we call in media professionals, sometimes we call in education from the field of education, sometimes we call from the field of folk arts, sometimes from various sectors we call in the professionals. They would speak to the girls, and then according to their likes and passions, they will come back to us. Yes, father, I am interested in this particular thing, could you please help me how to go forward? So once the child shows interest, then the next level, and the third level, and the fourth level, probably or fifth or sixth level, the child gets settled in life. Like, yeah, settled in the life in the sense, okay, gets into the field where the child is interested in. Yeah, that's where the second life begins, as far as the career is concerned. Like, yeah. So one of the options,
Yes.
yeah.
Yes,
So
you're
one of the
right, father.
option,
I think career guidance is something which each institution has emphasized on, and it
yeah,
is done in different ways, and that's very important. But
yes, ma'am.
sorry to cut you short there.
Yeah,
I'm also keeping the time in mind, and I'll move
yeah.
to Father Wellington on that note because they have a
Yeah,
very
because ma'am,
interesting.
I have many other things actually, but we got stuck only with digital media. There are down the line, there are other
I'm
possibilities.
sure. I am
Yeah,
sure
yes, ma'am.
there's a range of courses that
Yeah,
everyone offers.
exactly,
But
exactly, ma'am,
the most
exactly.
important point that you brought out was about also investing in
Mm.
career guidance, career
Yes,
counseling.
ma'am, yes, ma'am. Yeah, yeah,
If
that's true.
children truly have to participate in their own
Yeah, exactly,
decision.
ma'am, exactly. Yeah, yeah,
Yes.
yeah.
And taking a cue from there, I'll move to Father Wellington, where we found a very interesting position of social worker education. So we have social workers in all institutions, but you have social worker education. And how did you decide, and how does that help, children in the CCI? Because that's probably that could be an area to look at for as part of Mission Vatsalya. When Mission Vatsalya says you have to have X number of social workers or counselors, uh, are we then in future wanting to ask Mission Vatsalya to also create a position of social worker education, if that is that comes out as a useful model?
Yeah, thank you for inviting me on this panel. Oh, this post of education social worker has been thought about because when the child enters the institution, child is not just coming for the shelter or for food. Food he or she will get outside as well. Shelter they might find somewhere, but the important part is the education because that is the only ladder which will help them to get out of this vicious cycle of poverty. And therefore this post of a education social worker has been thought about. So there is a dedicated person who pays attention into the educational or the academic aspect of each child, where the person also visits the schools, person takes the feedbacks from the schools, the matters of finance like the fees, paying of the fees or any aspect that comes under this, category has been taken care by the social worker. And obviously, she doesn't work alone, but she coordinates with the house parents, coordinates with the social workers, with the management, and the entire team together tries to come out with a possible solution for that child to move or to dream ahead in life. So, like every year, we also have a system called evaluation of the child. So, in that evaluation, whatever the education social worker brings, it's been taken up. And if the child says, like in the future, he or she would like to be a doctor, then the part of the team is that we start gathering all our resources, so finding out all our resources so that the child fulfills that dream. So that's how this post, I feel it's very important, and uh, it helps a lot to the child and to the management to think how the entire program can be set up for the child.
You are on mute, Bharti.
I'm so sorry. Thank you. Yeah, so like I said, probably something to think about in future, for such a position which other CCIs could look at. A more generic question to everyone, whoever wishes to answer. Since we found that JJ Act has a mandate of non-discrimination, and also inclusive care and rehabilitation programs. We do see childcare institutions struggling to accommodate children with disabilities, children with diverse gender identities, or other special learning needs. So, what systemic changes, whether it's in admission policies, infrastructure design, funding, daily routines of children, their peer interactions, and care planning, staff training, what are those changes that could be needed to actually genuinely have inclusive and barrier free childcare institutions?
Can I answer?
Yes, please.
This is Sheila again. Actually, when APSA started, we tried to introduce children with disability, but one of the most important aspect was accessibility. So we having accessibility was the major difficulty for us, because the building is already built with an idea, with a different idea, but we had 7 to 8 disabled children where we had difficulty in accessibility is one, which nobody thinks about having them in the initial stage. The other one is also funding, because the ratio of caregiver to child is also needed to be more than a child in institutional care than for need and protection than a child in disability, because of their little difficulties. The third one is also, I think, the JJ Act itself has discriminated boys and girls. APSA had boys and girls for more than 20 years, and we did not find any difficulty in looking after them, because there is a lot of companionship, there is a lot of friendship, there is a lot of understanding of both genders, and we did not find any difficulty in looking after them until they changed the policy to make it girls and boys. And after it was shifted to girls and boys, I think we have more difficulties into girls looking out for more boys all the time, or when they exist within them, there is no difficulties. And with our 20 years of experience, we did not face any difficulty in those days itself. So I think these three aspects of this, and also the policy needs to be in terms of their education, which needs to be much more flexible, because we have seen that if the NIO starts from the 7th standard, the National Open School, it enables them to move on for further education very comfortably, because you can choose the subject that you want, and to also move on to the next class and next class without even commuting very long distance to school. I think these 3 or 4 things, if there is a change, one is accessibility, second is funding, caregivers is very important, and the education system has to have a lot of inclusiveness for them, so that then they with any disability, their access to education, open school is very important. Thank you.
Thank you. Anyone else would like to come on this?
Yeah, I would say that, we do have a special village, children for with the disabilities. They are in a special village, which is really built in a different manner. The structure of the homes is very different as compared to the regular family homes which we have in other projects. So we need to look at the fact that if you are wanting to have in a CCI children with special abilities, special disabilities, we need to have a infrastructure to support them. Infrastructure would not only mean staff but also medical staff, like physiotherapists will be required, or a speech, I mean, some special speech therapist or special doctors and nurses, and also a funding required, and the ratio of staffing ratio as defined currently under Mission Vatsalya. So it will be totally a different structure which will have to be there for having inclusivity in the CCIs for children with disabilities. So that has to be defined, which is not yet clearly defined under the JJ Act under for the CCIs separately.
Right. And what about children with different gender identities? I mean, with disabilities, very
Yeah,
clearly,
it's
it
not
is
defined.
about.
It is not defined currently anyway. I don't think so. So we'll have to work on that also, because of course it is, as an organization, as a CCI, you cannot differentiate between them. And we do have challenges because now in CCIs, when children are coming at much later age, and they have been overexposed to many things by the time they come into the system. So we do have challenges on that, but we need to define that what is it, how what type of structure and co-worker specializations, and what type of funding support can the government give, and what type of systemic support can government give to help CCIs integrate such children into the system.
Yeah, because a
Yeah,
lot of us,
the
yes,
yeah,
Father
may
Wellington,
yes,
you'd
yes,
like to come in?
yeah.
Yes.
I agree with the panelists that they have shared. Like the infrastructure development has to be at a better stage if you want to really go towards that integration, as well as like it can be if the law or the policymakers, if they define like which are the disabilities that can be easily integrated into CCIs, can be done very well. Because I know like in Sneha Sadan in the olden days, as I have heard from ex-children, like there used to be children who cannot speak, who cannot hear properly, even the children who were like transgenders, when all were accommodated in the house and they were taken care very well. So even if we really educate the staff, the social involvement of the child can be taken care of. Only the infrastructural challenges which will be always forcing.
And in the current models, is enough spent on educating staff around diversity and intersectionality?
Yeah, we do in our current models, like in terms of educating on diversity, gender sensitivity, on safeguarding and inclusivity. That education is definitely given to our co-workers. And as an organization, as a CCI, we do not differentiate between children. So we do have sometimes children with like as Father Wellington has said, that about challenges with children having, say, if they cannot hear very clearly, or they have slight mobility issues, we do have them in our regular projects. And also there is an issue that, we our current system doesn't allow a child to move from one state to another state. Like even if we have a special village in one of our locations, our current rule doesn't allow, our JJ Act doesn't allow a movement of a child from one state to another state. Rather, in some places, there is challenges of moving a child from one district to another district. As a result of which, giving a proper care, if we have a facility somewhere, it becomes restrictive, or the process takes too long. Yeah.
Yeah, amidst all those challenges, I think there are issues which need to be, I think, discussed more, and unfortunately, we don't have time for that. but we are getting some questions and we'll take them up, some comments and questions, we'll take them up
I
subsequently.
think one more small. No, we were
Yes.
talking about caregivers and co-workers or whatever. The challenge now is we are not getting qualified co-workers, and I think it's an universal issue because of various reasons. And it is very important to have a qualified caregiver who gives appropriate inputs. Now, you were talking about inclusion, you were talking about gender sensitivity. I think among children, it doesn't exist as much as it exists with adult caregivers, you know. So I think it's very important to have very trained helpers or caregivers to be part of this entire system so that the discrimination, whether it's sexuality or sexual orientation, gender discrimination, it's very important. Unfortunately, our caregivers are not so qualified. And I think this issue is with everybody. Thank you.
Yes, so probably one putting down a sort of I don't know whether I'm using the right word, but some kind of a job description with clear roles, clarity on what is expected, and then matching it with people and investing more in human resource development for childcare institutions is definitely an area to look at. And we I do have some other questions. More important is the question about discipline, protection versus autonomy, versus dealing with adolescent sexuality, issues of identity, body, relationships. So you did mention that you had both boys and girls together in your institution, Sheila, at one point of time for 20 years. But these are becoming challenges, and we do get to hear, as Anuradha had said, that children are becoming more. They are more exposed these days. So how do CCIs manage and balance this, and what would be your recommendation for the government to deal with these complexities?
So I don't know under what, how much research they have done to bring down to different boys in a different institution and girls different institution, because at least children who are 7 to 14 could stay together. And I think it's very important to build that relationship between both genders. And discipline is how you bring about the changes within your institution. What type of values that you build within the institution, what type of inputs that you give them, when we talk about work, also we talk about different genders. A boy should be doing this, a girl should be doing this. But in an institution, if you can build the capacity of both genders into looking at the aspect of work as a work for every individual person in the institution also is very important. So we feel that like you said, there are incidents and issues that have come up because of keeping both boys and girls together. We could still not stop children from the age of 7 to 14 to stay together. I know, and that's where they build the understanding of knowing each other and being with each other and understanding the different angle of issues that they be facing together.
Any other
I would
thoughts?
like to, yeah, I would like to just
Yes.
take on from what Sheila said. I really, like in SOS also, we had the boys and girls staying together till the age of 14 in the family houses. So, of course, with the change in the rules, we have had gender segregation and age segregation done at every project level. And the downside of that, as Sheila has mentioned, is about the gender sensitivity of a family having, where the boys they learn uh, the skills of how to interact with the sister and with the mother. So the children they do develop that emotional connect, that emotional vibes are developed a lot, and when they are then both the genders are existing. In SOS currently, we have in terms of inclusion, for safeguarding, we have included all stakeholders into it, right? From the we have the mother, the youth father, the village committee is then involved in the child safeguarding education awareness. So it is inclusion of the CWC and transparency and reaching out to everybody so as to ensure that child safeguarding becomes every person's work. It is not one person's work. So that is about awareness and all what is specific also, that if it can be done in the JJ Act, currently we have age appropriate work is not defined, that for what age what type of work. So some more clarity on that, if can be detailed out, it helps people to be very systematic and very consistent across. That is one thing. And of course there is a daily routine defined. So if some more specific detailing can be done under JJ Act or under the Mission Vasalya scheme, it just helps everybody to be consistent. Then also in terms of uh, supporting a child, even if supporting the child when the child is having a safeguarding issue, suppose even if it is a mild one, there has to be an adult, like we have the mother, the house mother, who is totally always connected with the child, and the co-worker. We have the village child protection committee which is connected with the child, and everything gets discussed. There is nothing wrong in reporting or responding is not penalized or being punitive, that this home has got, it is good to report than to underreport, I would say. So there has to be a reporting and a responding mechanism in the organization, and people should be accepting it. All stakeholders have to be involved in it, so that it becomes a very part of the weave of life in an organization, I would say. Yeah.
Thank you. Um, yeah, I think I'm moving more towards the last part of the session because we have to wind up. I do see a lot of organizations, many of you are not just running childcare institutions, but you also have outreach programs, community engagement programs. Whereas there are some who are purely only childcare institutions. But what do you see as the future for childcare institutions, given a lot of these complexities, given a lot of legal compliances and the current situation? Do you see childcare institutions as evolving into community integrated learning and transition hubs? Do you see childcare institutions as part of community care systems? Uh, any thoughts around what would be the future of CCIs given these complexities?
Well, can I go?
Yes.
So, so I think so. We are already what we feel in SOS and what we are already implementing is that we are having our foster families in the community already. There's one part of it. Secondly, we have done a lot of reintegration, and we are supporting those children under our kinship care program. Kinship is akin to the sponsorship program of the government. So we continue with the monitoring and the same support a child would have got in a CCI, but with their biological relatives or their closer kin. That is one part of the program. And thirdly is also the community program, that is the family strengthening program in the community around. So which is focusing on the development, supporting the child by supporting the family. So there are different basket of care solutions like SOS has for looking at the specific needs of every child. So I would say the future is going in that direction, which is very well defined in the current scheme of events at Mission Vatsalya, that CCIs will be a temporary place of shelter for children who have nobody, no place to go, and they need constant and attention. That what we're looking at. But definitely we are, like, we in SOS also do a SIR every year for children. So if the situation has improved for the child in the biological relatives, like supposing a child has an elder sister who is earning or has a family and she wants to take back a child, her sister or sibling with her, and but we support the education and the development and the settlement the way the child would have got that support staying in our CCI. That's the future which we were looking at, actually. Yeah. Thank you.
Yeah,
I'd
one
like
more
to
thing
add.
that I would like to add.
Um,
Yeah. Sorry.
I think we'll go with Father Wellington first, and then we'll come to you, Sheila.
What I would like to add is like the foster care model that is there, which is really going to a helpful model for the children who can be put into those kind of homes, as well as what we try to do is like wherever there is a possible, and if there is a possibility, restore the child with the mother or whoever the parent, and if they just need an educational support, provide them that. If they need a connecting center where the child can go for the day, and at night child is back with their parents, so try to find out those kind of support centers for them. So that is the kind of linkage we try to do. For the CCIs, I would means I feel it's my personal thing that we have to reduce the size of the CCI, the number in the CCIs. Sometimes the CCIs are having 50, 100, 150 children. It's, which is similar to cattle shed. So, very unfortunate to say that we must have smaller numbers in CCI, like what SOS is having. The smaller, like it's a small home. It's not, and again, the way we label it, if we label it CCI or Anath Ashram, then the child will be like, feeling that. But if we call it home, then the feeling of home will be different. So there is where we'll have to also focus as regards to the CCIs, downsizing the number. That that is what the Sneha Sadan tried to do, but having small home spread across. But then we met with a difficulty of having different licenses, then having different staffing system for each home. So having 25 staff in each home, if I have 25 staff in 8 homes, financially which will not be feasible for an organization. So even the government will have to tailor their program for each NGOs also at certain length.
Right. So that flexibility is important, and you've raised some very, very important issues. Thank you so much, Sheila.
Yeah, I think this would be an excellent approach that we should look forward, at least in future, learn from the best practices of others who are started. Because I always think in an institution we would spend about 4,000 to 5,000 rupees per child per month, plus the education, plus the other stuff that we give the children. And if we think if we this same amount can be given to the community, either the kin or a community which is ready to look after children, either in a group, 2 or 3 children together. So if the same amount can be given to them, what you are spending, and also link other schemes like the PDS, housing, other benefits that is given to the urban poor community or the community, I think in a wholesome, we could see a fairly good resource going into the community. And in turn, we will have the children taken care by the community, which will be a complete growth for the child, a life worth living for them. Because in the institution, we see whatever the 100% that we give with child participation, with the food, nutrition, education, they still miss the component of being with the family, with the community, and they look forward for this. I think this would be a good approach, at least for a future children who are in CCI, and it can be done in trial basis or a pilot to see how it is and how it will work. And there are organizations already working on foster care, building guidelines, building policies. I think if it is a combination of two and see how we link enough resources to a community, it would be the best for a child who's growing in an institution.
Thank you so much. So that's very clear that it has to be a combination, and CCIs can no longer work in isolation only as an institution, and of course, destigmatizing and delabeling is very important. With that, what is important and is coming out clearly is some kind of change in the law, in the rules, to bring in this flexibility and to do away with the kind of rigidities we have today. I think I'm done with my questions. Just one last thought that you may want to share, each one of you, any one word or two-word reflection from each of you on what the future CCI should stand for, I mean, the words could be anything, belonging, inclusion, continuum, whatever you feel like, any one word.
I think it should be a lot with lot of empathy and the agency to the child given in terms of the decision that should be made for the future.
That was too many words, but thank you.
I would say
I feel
continuum
it is
and
the,
continuum and participation, and that is what is important.
I feel it is the self motivation of each person who works in CCI is very important.
Fantastic. Yeah, thank you so much. And we'll take some of the comments that have that we've received. Um, yeah, one comment is to start with Shivangi. Should we restrict young girls to digital and work from home as a default choice in the need for protection? Should their gender decide their nature of work? And a linked question is women, it's a comment rather, women figuring out careers based on interest and capacity rather than gender builds their confidence for independent living. Something as simple as learning to ride a cycle two-wheeler on the road can be liberating. I think there's a question and the answer has also come to us through this comment, unless any one of you would like to
Yeah,
say
I'll just like
something.
to add one more angle to it, that like in SOS, we have a very scientific way of understanding the child's multiple intelligence and multiple natures assessment we do for a child when the child clears class 10th and before passing out from class 12th, so as to help us understand where is the more probability of a child to be successful, and then there is a participation of the child along with the house mother and the co-worker and the village in charge to really understand that how does this report link up with the type of behavior, type of aspirations a child has. And so there's a very structured intervention done to look at what is, so irrespective of the gender of a person, or for the matter that, so it is, one is looking at their abilities, the capacities, and their aspirations, and then figuring out where the child is wanting to go. So having a more scientific way of looking at things will always be better, I feel.
Yeah, thank you. And I'm sure Sheila and Father Wellington will be in agreement. I think we've lost Father Ashok uh, unless he's there, and I'm missing him. Um, yeah, okay. So the next question is on again, inclusion, as we've been discussing. Ashika says inclusion is an ongoing process, not something that is static. Indeed, and then Shivangi has said that we must look at universal design for children and adults with disabilities, something that came out very strongly from the previous panel as well. So I think that should become one of the clearer recommendations from this discussion today. She's also adding that universal design creates spaces, services, systems that are accessible and inclusive for everyone, not just those on the margins. And interestingly, now Mission Vatsalya has provision for having CCIs for children with special needs. But there will always be a question as to whether we create these special institutions for children with special needs, or we become inclusive in the existing, institutions that we have. Okay, so the question on age segregation, there's a comment which says that age segregation is proving to be detrimental. But in the CCI space, there will always be a need for age segregation in the name of protecting children. What Sheila had pointed out, I think, was that if we can engage with children on issues that help them make better choices, that help them make better decisions for themselves, then I think we would probably deal with a lot more hassles or issues that we see as hassles today. So yeah, and one question that is now coming up from Dr. Sangeeta, we need to stop segregation on grounds of age, sex, gender, or disability. It's a comment. But so I want to hear from you as to what do you feel about it. I mean, I certainly have my own views, but I think you are running those spaces. You know it best.
Yeah, at the since Sneha Sadan has a mixed age group in their houses, and it serves a quite a good purpose where the elder boys or the elder girls take care of the younger ones, and the younger ones look towards the elder ones as they move into their life, after 18, when they go for their jobs and all, no. So a kind of a dream is being created that one day even I want to be like Didi, I want to be like Bhaiya.
Yeah, I would like to agree to what Father Wellington has said, that having up to a particular age, say like in JJ Act, we have it defined, say up to 10 years or at least up to 12 years, where we can, because the children now are coming into CCIs after the age of class, I mean after 6 years, so they're coming at 7 years or 8 years. So there is some need for them to ease out in life, to balance out in life, to be in an environment or into an ecosystem which is a microcosm of a ideal family home in the society. So how to when so if we create that microcosm in a CCI, which is a family home which has got both genders, there is a mother, there is a family feeling, that really binds or bonds the child and gives a sense of stability to a child for lifelong understanding about both genders, understanding about how to deal with life situations, how to respect each other, the genders. I mean, there's a mutual respect and a mutual understanding. There's a sort of a song which comes out they say, from every house. So that is what happens. So we need to really appreciate that, and protection doesn't come by stopping something, I would say. Protection comes from education, awareness, because even if you stop somebody, you are not sure that if a person wants to do something wrong, they can find a way to do it. So let's make people educated, give them the sense of, as people, as human beings, we have a sense of discrimination, we are intelligent people. Let us develop that in a child rather than trying to differentiate them and put them in boxes, I would say.
So we actually need a how to do it manual,
Yeah.
because unless we
Exactly.
explain it, people will not understand. They'll feel that this is something
Yeah.
too idealistic. Now, having said that, one even when we were talking about being inclusive, there was one thing that was coming to my mind while doing this research. We saw that a lot of institutions have segregated spaces for girls who are rescued from brothels, girls who are pregnant, who have cases under the POXO Act, girls who are rescued from marriages and are pregnant. So, on one hand, the CCIs are actually justifying this segregation, and on the other hand, today we are talking about being inclusive. How does that work?
It's a very difficult question. Anyway, I feel that the CCIs should inclusive is what we believe is very important. But when it comes to girls who are pregnant and who need special attention, I think should not be a part of a CCI. It should be part of a different system where the child gets different attention and parental inputs, and therefore the other inputs that is relevant. But if I believe in inclusiveness, but I'm also struggling with this. When a child comes pregnant, what would happen to the child who is already has a infatuation? Would she think that this is normal? Is this accepted? There's a lot of thought on this, and looking at all these things, it's very difficult to bring into saying that when it comes to this, inclusiveness is important or not important.
Yeah, somewhere we'll have to draw a slight different line, because children who are supposing pregnant and they are POXO victims, so they require a lot of closer attention. Mental health of theirs is very affected, so they require. We do take care of them. We do bring them to the houses, our family houses, but we have a constantly a mother or aunt taking care of that person child, because that mental trauma which the child has gone through, and the fact that, and secondly, there's also a feeling that how now my life is different from the others, so it is also a stigmatization is there. So one has to be very careful, and one has to draw a line on case to case basis. It cannot be a generic thing.
The case to case basis. Thank you
Yeah.
for leaving us on that note. and the fact that we have to look at protection not from a protectionist vision but from an empowering vision. So while we talk of having specialized attention for on a case to case basis, we also have to be aware that we're not becoming exclusion oriented, and and inclusion remains our guiding principle. On that note, I think I've taken more time. All of you, thank you so much for joining us, and thank you for being part of this research
Bharti,
as well.
I had a suggestion. So there were
Yes.
two, three questions that have come, which are, I think, relevant. If you want, you can take like 2 minutes more if somebody wants to answer.
Thank you so much. Yes, there are a couple of questions. There are in fact lots here. So one question was, I think, to do with the policy. Mm, I don't know where it's gone. There are so many questions. So as someone who had raised a question regarding policies, would you like to come up and share?
This one, what are some changes we want to see from the JJ Act and rules
Yes.
to enable CCIs to function better?
Yeah.
Yeah,
What are some changes?
can I just take this, give my viewpoint on that?
Yes, please.
Yeah, so as we discussed earlier, that it has to be a model which is very a combination of you can say a CCI and a group foster care. Like the group foster care was a combination model where you have an adult mother or to take care of the child, and there is a family bonding. There's a family-based concept, and this is but currently the JJ Act talks about only individuals to run a foster care. It is not talking about institutions running a foster care. I would say that this was earlier there, and somehow it got eliminated later on. But that's something very important. The fact that when there is an entire system working on the child's development, that gives much more options, like a big joint family. For a child to reach out and take help from people all in the system. So that's something which is important, and also the fact about inclusivity we talked about for children with special disabilities, that should be enabled, and also the staffing pattern for that and the costing and funding has to be relooked at. Thirdly, also it will be important to look at that how can we look at that gender assimilation, and instead of segregation, how can we have gender together up to a particular age to develop a family bonds or families type of structures which is actually reflective of what a regular family is, and if possible to look at community based family foster family, so that children get much more exposed to the community living as well as to the fact that they are living in a family unit by themselves. Yeah, thank you.
Anyone else? Father Willington? Sheila, would
Yeah,
you like?
I agree with ma'am that family unit counts a lot because child is away from family and child needs a family. And especially in the Asian context, as we grow up in that atmosphere, in that environment, which is needed, as well as JJAC seems to be like one shoe fits for all. We'll have to even look into that. As well as in the recent years, there's a lot of clerical work that has increased, which also burdens the CCIs and the attention into doing the clerical work, and less attention is given then to the children by the probation officers, by the counselors, or the education social workers. So that also becomes a bit of hindrance.
Sheila.
Yeah. I like second what Anuradha said, that it should be a part, it should be inclusive, especially age appropriate inclusion is very important. I also feel that the inclusion should consist of children with disability. I also add children with different sexual orientation. It should be inclusive. And it's very important once this inclusion is there with age appropriate. And I think the development of a child is very it's very appropriate for them to be growing into in an institution. The other one is very interesting is the community model that I would really feel that is the need, because after 30 years of running an institution, we still feel that's the only gap that the organization is facing, that they want to be part of the rest of the community. And how do they become the rest of the community? Only when they are part of the community. And that is very important. And that's what I feel it's as to the way forward.
Thank you so much. Such powerful thoughts and very critical, important thoughts for consideration. But I also see a very, very important comment here, which says that children who don't measure up to some metrics end up in the government homes, whether it's disability, mental health concerns, and those who are pregnant, etc. Like sometimes NGO-run homes want only the shining stars and those that succeed academically or in metrics.
Not
Uh,
true. Not
we
true
don't
at
have to
all.
defend this. We don't have to
No,
We
no, I
defend
don't
would
this.
we don't have any choice,
like to
actually.
Right.
I would like to also tell you that when I was a CWC member, I intentionally took children who had TB, children who had nutrition deficiency, children who were children of sex workers, or children who had been into sex and have come out, so that this inclusion works well. And we have been successful. And the confidentiality is very important. And we have seen none of the children spoke badly about. There may be an adult who have spoken, but not the children. And this inclusion is very important for the children to grow together, especially when they do not have parental care.
Thank you so much. Yes, so on that note, I think we should close the session. Um, we do understand that the organizations that are present today for this panel have, you were also promising practices in the report. But there are several other organizations that we are talking about. And I think the idea was to document your practices and take them to others and see how they can be replicated. On the note of inclusion, on the note of being promoting gender transformative practices even in institutional care and rehabilitation programs, I think we'll close this session. Thank you so much once again.
Thank you.
Thank you. Thank you, Sagata. Thank you, Bharti. Bye.
On behalf of Enfold, I just want to thank each one of you, particularly Bharti, who actually led the study, and together with several members of the Enfold team, spoke to each one of you who joined us as panelists. And it's been a lot of food for thought. I think so many insights have emerged, and we hope that you will all engage with the report and we can keep this conversation going. So thank you
Thank you
very
so
much.
much. Thank you.
Thank you. Thank you, Enfold.
Thank you, everyone.